So the nominations were Deputy Doublé and Deputy Porret. The first in time was Deputy Doublé, so I invite Deputy Porret to withdraw. From the Assembly. And so I invite Deputy Doublé to speak for up to 10 minutes, and after which you'll face up to 20 minutes of questions. Deputy.
Thank you, sir. I would like to begin by thanking the outgoing scrutiny panel for their work under the chairmanship of Deputy Ward, and also to congratulate the new ministers and assistant ministers for health and social security on their appointments to these roles. Sir, I wish to serve the Assembly as chair of the Health and Social Panel. I bring experience to the role, an understanding of research methods and an evidence-based approach always, an inclusive way of working, an ability to rigorously examine policies and legislation across ministerial portfolios, and innovative ideas for engaging with the public. I will touch on my background and experience. I studied psychology at university, which gave me a good grounding in understanding research, which is, of course, critical for good scrutiny. That evidence-based approach has always been a part of my ethos. I went on to study for a postgraduate teaching qualification and taught in our schools for 8 years before becoming a States member. My first term, which began in 2014, I chaired the Education and Home Affairs Scrutiny Panel, as it was then. That was nearly 10 years ago, sir, and I had just turned 30, which will give away the big birthday that I have coming up actually tomorrow. Thank you. Not quite there yet, one more day of being in my 30s. For my second term, sir, I decided not to seek to chair one of the main panels, but to work on many other panels and committees, including chairing the Diversity Forum, chairing the UNICEF Baby Friendly Committee, a member of the Early Years Policy Development Board, States Trustee for Jersey Community Relations Trust, and a member of the CPA. As well as these roles, I established and chaired a review panel into the gender pay gap in Jersey, one of the first review panels established by Scrutiny, and I'm very proud of the work that we did there. Some way into the term, I was also invited to join the Children, Education and Home Affairs panel and the Care of Children panel, both of which I managed to fit in. And I also petitioned the Health panel to initiate a review into maternity services, which they did start, and I was co-opted onto the panel to take part in this review, which I very much enjoyed taking part in. So my interests are very broad, and I try to use the time I have to be as productive as possible and cover as many areas as I can. Members may wonder why I'm interested in this subject area of health and social services and social security. Social security I have always been interested in because social policy is very much an area of strength and passion for me. I'm very interested in scrutinising this area, and I'm keen to see what the new minister will put in place. My experiences as a woman and as a mother have given me an insight into our health system. And these experiences have been valuable and helped me to see the need, for example, for a review of the maternity services. So I mentioned my age, and I think health becomes something that we're more aware of as we get older, and certainly also having been a member of this assembly throughout the pandemic underlined the importance of our health service. Some of the health issues I've had myself, sir, that members will be aware of, because I do discuss it, I think it's important for awareness purposes. I suffered with long COVID for 2 years. I have fully recovered now, but at times that illness was acutely disabling and made me really realise and understand the importance of our health services. I want our healthcare system to be the best that it can be. So it's not just those in middle age and old age that face health challenges. I also understand the needs of children, and I've realised that there can be a disconnect here between departments. So when the panel is established, of course, the panel members as a whole will make final decisions on reviews, and a good chair needs to be able to manage diverse views. We are in the middle of transformation of our healthcare system, and this needs to be carefully monitored. We need to look at the affordability of our healthcare system. Are the plans that are underway sustainable, and will we be able to afford to deliver the improvements that our population are demanding? We, of course, have an ageing population, and they need to be properly supported, and I would like to understand how this can best be done. My ethos as a chair, sir. First of all, integrity is absolutely the most important thing and is my guiding principle in any work I do. Impartiality is absolutely critical in scrutiny. Scrutiny is not about me. It is about the public. It is about states members, and it is about listening to those views. It is also important to maintain good relationships with ministers and assistant ministers, and so respect is absolutely key here. I respect every single member of this assembly, and I am prepared to work with any member in order to achieve good outcomes for the public. The aim of scrutiny is not simply to criticise. In my previous scrutiny reports, sir, I have always emphasised the positives that I found in that review work. And ultimately, successful scrutiny helps ministers to produce effective policies and legislation. As a chair, sir, I am innovative. In the past, I have pioneered many new ways of working on scrutiny. My panel, in my first term, was the first to hold evening meetings for the public to attend and share their views. We were also the first panel to use focus groups as part of our research. In the past, sir, when I have presented reviews that I have authored with my panel to the Assembly, I have regularly made use of the ability to make an accompanying statement and to take questions from members on said review. The use of review panels is important, sir. The Gender Pay Gap panel was one of the first review panels established, using the mechanism to co-opt members. I have been co-opted in the past, and as a chair, I also co-opted other members onto my panel, and I would welcome doing this for any members who perhaps don't want to be the member of a main panel but have specific interest in reviews. I was also the first lead member to engage directly with children and gather evidence from them using a variety of methods, and I would continue to develop this using the participation standards. I have a vision, sir, for enabling the public to have their say. I would like to explore different ways of contributing. For example, online polls, Facebook Live sessions with questions where people can post their views in the comments in real time, gathering views online. Parish consulting groups. I think the parishes are an untapped resource for engaging with the public, and I would like to do more here. Sir, I am an inclusive chair. Work planning is important to ensure a good spread of review and question topics and listening to a cross-section of the public. It's important to engage with unions and other user groups. I would work flexibly with panel members, sir. As a chair, I seek to empower my panel and to put their skills, time, and knowledge to best use. In the past, I have encouraged panel members to take a lead member role and to lead their own reviews, and I would be minded to do the same with the right team. And it should be a team, sir. It is important to work together. We will disagree sometimes, and this is actually critical for good scrutiny. I would seek out diverse members from across the Assembly in order to find this mixture. Sir, the team is the most important thing, and I would very much like to build a team from across the Assembly and put my experience, impartiality and integrity to good use in this role. I welcome questions from members, sir.
Thank you, Deputy. Are there any questions for Deputy Dublet? Deputy Stevenson.
Thank you, sir. Health is currently a highly politicised area, yet of course it is an area of absolute priority. How does the candidate intend to navigate this challenging landscape while remaining objective as scrutiny requires?
Deputy.
Thank you, sir. I actually think that I'm ideally placed to scrutinise these policy areas. I don't particularly have any vested interests in either of the policy areas. I have respect for both of the ministers and for the assistant ministers, and I want them to succeed. And my wish is to be a constructive part of that success.
Supplementary?
Yes, sir, thank you. Given that requirement to be objective, how would the candidate manage conflicts of interest should they arise during her work chairing the panel?
Thank you, sir. Conflicts are actually a passion of mine because I believe in going above and beyond in managing conflicts. That's something I learned actually on scrutiny from the first panel officer that I worked with, and he drilled that into to the panel. And at the time, other chairs have mentioned that they had as a standing agenda item any conflicts. That's something I used to do 10 years ago, and I would continue to do that. When I was an assistant minister, I sat both of my ministers down and I went through any, not just financial conflicts, because of course standing orders requires that we declare any direct financial conflicts, but I think it does go beyond that, and it's important to be transparent with those that you're working with. And I would do exactly the same, sir. I would sit down with whoever was I was going to say chairman's committee then, because that's what it was when I was first the chair, scrutiny liaison committee, just to ensure that there is transparency there. And I think other chairs have mentioned the need for training, and I'm completely behind that, because I think unless we have standards and guidelines for managing and declaring conflicts, sometimes it might not occur to people what actions to take, and I think that would be very helpful to have a standardised procedure across the scrutiny team.
Thank you, Deputy. Deputy Kovach.
Thank you, sir. What areas would the candidate see as priorities for review, both in health and social security?
Deputy.
Thank you, sir. I touched on some of the broader areas, but what I would like to do is maintain an overview of the health areas and the social security areas. That would be done through questionings and through the quarterly hearings, and then there would be some specific review topics as well. I mentioned the affordability of healthcare. Waiting lists are of concern to the public. The health strategy is going to be a big area that will need to be looked at. Health inequalities, sir. Raising sufficient income to be able to afford our healthcare over a period of time. The workforce, which is of course of concern across many areas, but particularly in health, will need a focus. I understand that the current panel, from looking at the documents from the current panel, they were looking at the review of the termination of pregnancy law, the maternity strategy, the dementia strategy, the mental health Jersey law, and the capacity and self-determination Jersey law. All of these areas I have an interest in, and I am keen to scrutinise. In social, I've got more for health. I would like to look at the women's health strategy. I would also like to look at transitions generally, so when children transition into adult healthcare. And I would like to understand better what the public want about where their healthcare is going to be delivered, and help the new minister to come to good decisions that are in the best interests of the public and what they want. Social security. I'm very interested, of course, in the period products scheme and paid parental leave, but also our discrimination law and whether any characteristics perhaps need to be added to the discrimination law there. And I believe some work needs to be done around pensions as well, sir.
Supplementary? Constable St Brillard.
Thank you, sir. Does the Deputy agree that single-sex spaces within the health service must remain single-sex in order to protect the sex-based rights of and dignity of biological women and girls?
I thank the Constable for his question, sir. This area is something that we were starting to talk about in education, and I was meeting all stakeholders to gather all views. The primary concern in any service delivery is the safety of the people who are using the services, and I would work to ensure that the Health Minister had that in mind.
Supplementary.
So does the candidate agree that her personal views won't be influenced by the views of the general public, which may not be in accord with her particular views? Thank you, sir.
Thank you, sir. I do not believe I have stated a personal view on this issue, and I have done that for a reason, because I think it is important to listen to everybody, and especially where it's a contentious issue. I think it's important that people respectfully are able to have their say, and I hope that ministers who are dealing with this issue will be able to do so sensitively, and I am happy to assist with this issue being discussed in a sensitive way that respects all of our islanders.
Thank you, Deputy. Deputy Tadier.
The candidate made an assertion saying that the parishes were an untapped resource for public engagement. What evidence does she have for that assertion?
Deputy.
Thank you, sir. Simply that I think they could be better used, and I would like to engage more with the constables, use the parish halls, perhaps access community groups, because I know that many of the constables are really good at having those links and those community groups, and I'd like to hear what they think when I'm undertaking scrutiny reviews.
Thank you, sir. Could the candidate outline whether she only intends to use parish halls for this kind of engagement? Would she seek to also do outreach in places like Communicare or Moyfont Village or the Good Companions Club at St Clement's, which do not necessarily involve premises for local government?
Absolutely, sir. I mentioned that I was the first panel chair to hold evening meetings, which again was down to the goodwill of the scrutiny officer, and scrutiny officers do fantastic work. And we held that evening meeting at the St Paul's Centre, but of course parish halls are an ideal venue, and I would look at any community venues around the island in order to best engage with the public. I think it's important that we go to where the public are. Sometimes we are stuck in holding our meetings in set rooms, and we do have some great facilities here, and the public are able to access them. I don't know if that's actually as widely known as it should be, that any scrutiny hearing, and a previous chair mentioned that in his speech, that scrutiny should be done in public. I firmly agree with that sentiment, and I would encourage the public to take more of an interest in scrutiny, because scrutiny is there to directly engage with the public, and perhaps has the time and the resources to do so more frequently than ministers who are very busy, and it's that gateway into influencing policy. So whilst I would encourage the public to access the scrutiny rooms where the hearings are, there's no reason why we perhaps couldn't go out and hold scrutiny hearings in the parish hall, for instance. I think, as I said, innovation is important, and I think scrutiny needs to continue to modernise and reach islanders where they are.
Thank you, Deputy. Deputy Scott.
Thank you, sir. Problem areas in health include data collection, lack of development of policy guidelines or awareness of them, and a bullying culture. What experience do you have in addressing or scrutinising such areas?
Deputy.
Apologies, sir. Could the Deputy repeat? I think it was 3 areas.
Data collection, lack of awareness or development of policy guidelines, and a bullying culture.
Thank you, sir. I have not scrutinised health specifically in the past beyond the maternity services review, but I believe all 3 of those areas were actually touched on in the maternity services review. So they're themes, aren't they, really underlying? So I think that's very helpful, actually, and I think what I will be doing if I'm appointed as chair, I'll be going back through members' questions to pull out any themes or any topics and putting that on the panel's agenda.
Supplementary.
Thank you, sir.
Deputy Rob Ward.
Thank you, sir. Can I ask the candidate what role she believes the panel has in scrutinising the development of new hospital facilities? Thank you, sir.
Deputy.
That's a great question, and I do firmly believe that that is such an important project that it needs to be established as a review panel. And I know that this has been done so far, and I would work with the other chairs because it is such a cross-cutting issue to establish a review panel for that area of work.
Supplementary?
Yes, sir. And also, given the importance of both areas of the remit, health and social security, are there any areas of social security the ministers, the chair, candidate, is what I'm trying to say, sorry, sir, is aware of that are perhaps equally as important or high up on the agenda in that area?
Can I just ask the Deputy to clarify? Is he asking me to compare any issues in social security and are they as important as the hospital? Is that...
I do apologise. It wasn't the best question I've ever asked, if I'm honest. I'm trying to say, are there any areas in social security that are perhaps of equal as importance in terms of the scale in social security that the Deputy would see as important in looking at as the scrutiny panel? How do you prioritise, if you like, the social security element of the remit? It was a bit better.
Thank you, sir. And that's a great question. And I'm used to historically scrutinising children, education and home affairs. And I think in the past, home affairs had been neglected. And I did strive to ensure that wasn't the case. And I would do the same with social security. And I think because we're waiting for some quite big policy decisions from health, I would perhaps, with the agreement of the panel, focus on social security in the first instance to make sure that it isn't forgotten. And then once some of those decisions come down the line from health about the direction of where health is going in our island, then there would be the time and the capacity to focus on health. But of course, it's always going to be a panel decision, and it very much depends on panel members' views and what they would like to scrutinise as well.
Thank you, Deputy. Any additional questions for... Yes, Deputy Ferry.
Thank you, sir. In relation to social security, the previous scrutiny panel produced a report on the overpayment of benefits. Does the candidate have a plan for carrying that review forward, sir?
Deputy.
I thank the member for his question, and I think one of the most important roles as a scrutiny chair is to make sure that previous reviews aren't forgotten. And that can be really difficult, and I think if we're honest, I'm not sure any one of us has really got that absolutely perfect, because there are always so many pressing issues coming to us as an assembly that must be examined. But what I would like to do is establish something akin to the decision tracker, which the state's graph. It's fantastic, by the way. If members haven't looked at it, please do, because I think a lot of work has gone into that. I would like to see something similar in scrutiny to keep track of recommendations of past panels. And that's something I think that should be done with the Scrutiny Liaison Committee.
Supplementary?
Supplemental, sir. So what's the candidate's view on writing off overpayment of benefits that are the fault of the department, sir?
I don't have a view on that at this time, so I would look at that report with the new panel once it's established.
Thank you, Deputy. Deputy Gardner.
Thank you, sir. Would candidate advise which of her previous scrutiny reviews was most impactful?
Deputy.
Thank you, sir. When I was a new member and I chaired the Education and Home Affairs Scrutiny Panel, there was a proposal to cut nursery funding. And I strongly opposed that, sir. Some members who were in the Assembly with me at the time will probably remember that. And the desire behind my opposition to it was that it was not motivated by what was in the best interests of children. It was motivated by a desire to make savings, and so that cut was attempted. And I succeeded in stopping that, sir, and I think as States members, there will always be one or two things that we feel we've really had an impact on, and that for me stands out as one of them. Another function that scrutiny panels can do is to make propositions and amendments. Again, I think that should be used more. So, for example, if a scrutiny report, if the recommendations have not been followed up on by the Minister, the panel does have the ability to bring a proposition or to amend legislation and propositions that are coming to the Assembly. And I did that, sir, with what was then the MTFP, which was the budget at the time, the medium-term financial plan. And I managed to restore $250,000 back into the education budget, which I believe would have had a positive impact at the time. And I achieved that with an evidence-based approach. I went through that MTFP line by line, and I scrutinised it down to the nth detail. And doing that, sir, enabled me to spot some of the hidden numbers or omission of numbers, and sorry, sir, that's probably unparliamentary, not omission of numbers, but some of the information that was perhaps harder to decipher and understand, which led me to then gather the evidence to bring that amendment and to restore that funding into the education department. So I also feel that the work I did around the gender pay gap, which again was with members from across the Assembly, with some differing points of view and a mix of genders, the work that we did on that panel, I think, has led to some significant cultural change in the island, and I'm very proud of the impact of those reviews.
Supplementary. Teddy.
Following on from the gender pay gap, would the potential chair consider scrutinising other pay gaps in Jersey, which include the racial pay gap, which we don't even know anything about yet, and perhaps other pay gaps that may exist with different demographics?
Deputy.
I thank the member for the question, and again, I absolutely agree with him. I think that could possibly make a really good review panel. I think inequalities generally are sometimes hidden, and I did refer to the ethnicity pay gap in the gender pay gap report, and I believe one of the recommendations was that further work should be done, so I would absolutely be behind that.
Supplementary. Any further questions for, yes, Deputy Ferrier?
Thank you, sir. I'm glad that the deputy mentioned, or the candidate mentioned, discrimination legislation in her speech. So what's the main difference between our discrimination law and the UK Equality Act is the omission in our legislation of the protected characteristic of religious belief. What is the candidate's view on incorporating religious belief as a protected characteristic within our legislation, sir?
Thank you, sir. And again, I wouldn't state my beliefs in a scrutiny context because it would depend on panel decision. But I do believe that evidence from the latest social survey points towards islanders wanting religion and belief, because of course beliefs, deeply held beliefs are not just religious beliefs, but islanders also hold non-religious beliefs which are should be protected as well. And that is certainly something that I could discuss with the panel.
So, without wanting to enter into a debate, it does arise from the previous question. Does the potential scrutiny chair accept that discrimination law is there to protect things that people can't control? So you can't control normally if you're a man or a woman, you can't control if you're born of a certain race, you can't control whether you're born with a disability, but you can control what your religion and what your beliefs are. So it's wrong to actually conflate beliefs, which can be any kind of belief, with actual characteristics that currently fall under discrimination.
It sounds like the deputy might like to join my panel if I'm appointed as chair, because I can see that he has an interest in this area, which I welcome. And I would seek to listen to all views and come to a decision based upon the consensus of the panel.
Time for a last question to the deputy. In that case, that brings...
Sorry, sir.
Yes, Dave Ferry, another one?
Again, not wanting to enter into a debate, but discrimination law is about protecting rights and freedoms. Does the candidate agree with that statement?
Yes, sir.
Thank you. Well, it's almost up to 20 minutes, so that brings that time for questions to an end. I'd invite Deputy Dublet to please withdraw and invite Deputy Porre to return to the chamber. Deputy Porre, are you ready to address the Assembly? In that case, you have 10 minutes to do so, then face some questions for up to 20 minutes.
Thank you, sir. Firstly, I would like to thank all members present for giving me the time and the opportunity to stand before the Assembly and to ask you all to consider me for the role of the Chair of the Health and Social Security Scrutiny Panel. The reason why I'm putting myself forward for the role is because I feel that scrutiny panels offer new members with a great opportunity to learn many aspects of the role of states members. It gives us hands-on involvement in the making of policies. It provides us with an in-depth understanding of how legislation is evaluated and measured. And it allows members to assess the impact that new policies have on everyday person. Most importantly, being in a scrutiny panel allows members to be the critical friend of our elected ministers. I would be honored to be the chair of this panel. I feel that I can offer continuity of the understanding of the work that the panel has done to date. And I will be able to provide corporate memory for the panel. I already have a good working relationship with the panel officers, so I would like to think anyway, and I feel that the past 2 years I have grown professionally and I'm now ready to take on a new responsibility. What other credentials do I have that potentially can make me a good chair, you may be asking? So I will provide members with a small narrative of my previous work experience, which I believe is of relevance to this role. I have extensive experience in working with people in many capacities. For instance, as a reliable member of a team, as well as providing care on an individual basis. For many years, I supported vulnerable people. Being a support worker meant that I had to work closely with my colleagues and develop trust. Trust is fundamental. When working in often volatile and highly stressful environments. But clear and effective communication with your colleagues is also important and makes for effective and productive work. I have worked with large teams, but also with small ones. But ultimately, the principle of respect amongst your work colleagues is essential if the team is to rely on each other to do the best that we possibly can do. Through my many years of working as self-employed, first by running restaurants and food outlets with my husband, and later as a sole trader, I have gained wide experience of managing people while holding the sole responsibility for the overall functioning of the businesses. Managing staff while keeping a friendly but professional approach, it's a skill which I have developed through my many years as a business person. My most relevant experience for this role, I must say, is the fact that I have spent the past 18 months as a member of 2 large scrutiny panels. The Health and Social Security Scrutiny Panel, where the workload has been extensive, mainly due to the fact that the health department is going through a period of upheaval and needed change. As a scrutiny panel, we developed relationships with the relevant ministers to achieve the best outcome for the island and the island people. The other scrutiny panel I served is the Children Education and Home Affairs Scrutiny Panel. With the latter scrutiny, I was given the privilege of chairing a review on the welfare of migrant workers. The chairing of the review panel was emotionally challenging, I may say, and a completely new review to Jersey regarding permit workers. The report produced has commanded the attention from the Assembly, and it has shone a light on the living and working conditions of migrant workers. The experience of the past 18 months has equipped me with an in-depth knowledge both on how the scrutiny should work, but more closely to the multiple areas of work that the Health and Social Security departments are dealing with. I believe this equips me well with knowledge and understanding in holding ministers to account in the best way on the key work streams that the minister will be responsible for. I would be honored to be given the chance to be the chair of the Health and Social Security panel, so I can continue the work I have started since the beginning of this term, and I have still much more value to add to it, and hopefully this time as a chair. I would like to thank members for your time, and I'm happy to take any questions. Thank you.
Thank you, Deputy Porry. Do we have some questions for the Deputy? Deputy Stevenson.
Thank you, sir. Health is currently a highly politicised area, yet of course it's an area of absolute priority. How does the candidate intend to navigate this challenging landscape while remaining objective as scrutiny requires?
Deputy.
Thank you. Thank you to the Deputy for a question. As a scrutiny panel, we very much work or reflect on the work the ministers will be doing. So in this particular sense, I will be very much responding to the areas of where the minister wants to start their work with, and then we will progress from there. But I think more importantly is to give the minister an opportunity to learn the portfolio and take on the work that is being left behind. Thank you.
Supplementary.
Given the requirement to be objective, how would the candidate manage conflicts of interest should they arise during their work chairing the panel?
Thank you for your question. Conflict of interest is something that all states members should be aware of, and we know that we have to declare any possible conflicts of interest when we're dealing with particular issues in the community. I would also be doing that if I was to give the role of the chair of the panel, no different from what I've done now, and I would hopefully have the officers helping me to assess the areas where this conflict of interest could possibly be a need to be declared. If it's in terms of other political parties, I can only say that scrutiny is scrutiny, and assembly work is assembly work. And in the great words of Jeff Surdin, the Deputy Jeff Surdin, when you're in scrutiny, you wear your scrutiny hat and you try and do the best possible job you can do. Thank you.
Thank you, Deputy. Deputy Kovac.
Thank you. I would ask the same question as the previous candidate. What priorities the candidate sees to seek review on, both on health and on social security?
Deputy.
Okay. Thank you for your question. My priorities, if I was to speak from a chair point of view, would be to look at the outcome of the review on overpayments that the scrutiny panel has just completed, and that would be good to have to see the end of it. Another area which I feel is going to be coming very soon to be debated is going to be the assisted dying issue. And I think as a panel, we really have to be prepared to deal with that. But I also believe that possibly will be a review on that. Outside from that, I'll be very reliant on what the minister will be doing, how the minister will intend to carry on its responsibilities, and how the minister will intend to prioritize them. Thank you.
Supplementary. Deputy Wilson.
Thank you, sir. Could I ask the candidate how she will actually go about prioritising the work programme associated with the scrutiny panel?
Deputy.
Thank you, Deputy, for your question. As I said previously on my last question, the scrutiny panel will work according to the work that the minister will be carrying on. We cannot, as a scrutiny, we cannot tell ministers what work to do, but we can support the ministers on the work they will be doing. So it's not about the scrutiny what work we want to do, but it will be more to the fact of what the minister will take us on his priorities or their priorities, and we as a scrutiny panel will follow with that. Thank you.
Supplementary?
Yes, thank you, sir. Would the candidate consider there is any further work that the scrutiny panel may enter into in relation to the recent rheumatology review?
Yes, obviously, we are expecting a review on that, and once the review is completed, we will work accordingly with that and with the minister. Thank you.
Thank you, Deputy. Deputy Sadio.
Does the candidate and potential chair have any ideas about engaging further with the public, especially perhaps with demographics and communities that up until now we've struggled to engage with?
Thank you for your question, Deputy. I think any member of this Assembly should be willing to work with a deep awareness of what the community wants. And I think if we are to make policies that are to benefit the island, the public opinion is very important. And again, depending on what pieces of work will come forward, if needs the public consultation, then that's what the panel should be doing. Thank you.
Supplementary?
Yeah. And could the candidate give some examples from our recent work on scrutiny where they have engaged effectively with the public?
Thank you for your follow-up question. Well, within that, the Health and Social Security Scrutiny Panel, yes, the last and the first piece of work we've done to date during this mandate has been on the overpayments social security overpayments. So this is not fully completed. We have we've given the recommendations to the minister, which reply was sent back to us. Unfortunately, on this instance, the panel has decided that the reply of the ministers wasn't completely satisfactory. And so right now we are waiting for the new minister to look into the review and come up with the answer to the recommendations if they wish to do so. Also, sorry, could you just ask the question?
Through the chair.
Yeah, thank you, sir. And it was largely about engagement with the public. So the experience that you've had in coming to those findings and
The
recommendations.
deputies had.
The deputy, yeah, that's right, sir. We need to put a bit of distance between us.
I know, you've got to try and bridge that by
Thank you,
talking
sir.
through the chair. Yes, deputy.
Okay, my experience with engaging with public in terms of finding their opinion in how certain issues are affecting their everyday life has been quite extensive, as I mentioned, through that the overpayments of Social Security, but as well while working as a panel member for the Children, Education and Home Affairs, where we extensively asked for the public participation, especially those who are most affected by the work permit issues. And it's been a great experience to understand how to call out the public for their opinion in terms of how to provide your questionnaires and how to basically ask those questions to the public and how to protect the public. Some of the many people who have benefited or who have participated in these two reviews I am talking about, often they are the most vulnerable. So we have had to be, as panels, we have to be very careful in how those questions were taken forward to the public, and we had a great deal of responsibility to these vulnerable people. But yes, their opinion still is relevant unless they can tell you of their stories and their experiences. Is very little we can do as states members. Thank you.
Thank you. Deputy Scott.
Thank you, sir. Problem areas in health include data collection, lack of development or awareness of policy guidelines, and a bullying culture. What experience does the candidate have in addressing or scrutinising these areas?
Deputy.
Thank you, Deputy, for your questions. I would say that the roles I have taken on the two panels I've been member of, we very much do that on the day-to-day basis. We scrutinize, we look at the data, we reflect upon, if we are not satisfied as a panel, we will be asking for ministers for further information. It is about a dialogue between the scrutiny panel and the ministers in order to gather the information necessary, being that in terms of data or not, in order to do our work. Obviously, the role of the officers are very important on that, and I would hope that the officers would be providing me with support to do the job properly. Thank you.
Supplementary?
Thank you, sir.
Thank you. Deputy Gardner.
Thank you, sir. If the candidate can advise what plans, if any, she has to scrutinise Health Board.
Deputy.
Thank you, Deputy, for your question. I feel that I may have touched that question already. As a scrutiny panel, even as a chair, we will be very much responding to the will of the minister and how the minister will choose to prioritize their workload. We will, as I said earlier on my original speech, we will be a critical friend, but it's not for the scrutiny to dictate what areas of work the minister will be doing, but whatever the minister will take forward, we will be alongside there helping to make sure that the work is done. Thank you.
Supplementary?
Absolutely, thank you. I agree on the first part. This is not the scrutiny panel to dictate the work of the minister. Saying this, I think it's the role of the scrutiny panel scrutinize areas that are important for the public, and as we know, Health Board is the area that's extremely important for the public, and it's working. So I would like to ask again what plans, if any, the chair has to scrutinize Health Board.
Deputy.
Okay, thank you for your second question. What areas? The area of the remuneration is something that we will intend to take as a panel as a matter of priority. Outside that, the Health Board, how is going to be taking forward from that? I would say we are very much going to be reliant on the new minister to start work and to carry on work on the facilities of the health, the health department. So far, I suppose maybe I'm not answering your question, but I will be looking...
Deputy Gardner's question, you referred to as Deputy Gardner's question.
Sorry, sir. So far, I cannot give Deputy Gardner a better answer, but I can say at the first instance, my priority, if elected as a member, will be to meet up with the Minister and talk through his priorities. Thank you.
Thank you. Any further questions for, yes, Deputy Ferry.
Thank you, sir. And it's only fair that I ask the same question as I did the previous candidate. In relation to social security, the candidate has already mentioned the overpayment of benefits review. What's her view on writing off overpayments that are the fault of the department, sir?
Deputy.
Sorry, could you just repeat the last bit of your sentence? Oh, sorry, sir.
Yes, sir, happy to repeat. What's the candidate's view on writing off overpayments that are not the fault of the individual and are the fault of the department, sir?
Deputy.
Thank you, sir, and I thank the Deputy for asking this question. As a scrutiny panel member, our work was done on the basis of how these overpayments will impact on the health and well-being of the people who benefit from those contributions. So my answer to you would be yes, writing off those overpayments, it's a very plausible and good way to go, because I believe if we are to found that these overpayments, in the way the panel is, that these overpayments are not always the fault of the constituent or the person in receipt of the benefit, to actually allow those overpayments to loom over people's heads while giving them so much stress and anxiety, the least that can be done is to write off those payments. Thank you.
Supplementary? Any further questions for Deputy Ore? In that case, that brings that period of questions to an end. And I invite Deputy Doublet to return to the chamber. As there are 2 candidates, the electronic voting system will be used. Any member wishing to vote for Deputy Doublé should press the pour button. Any member wishing to vote for Deputy Poré should press the conch button. Members who wish to abstain can do so in the usual way. I invite members to return to their seats and the greffier to open the voting. All members have the opportunity of casting their votes. I ask the greffier to close the voting. And I can announce that the result of the voting is as follows. Deputy Doublé, 24 votes. Deputy Poré, 21 votes. And 1 abstention. Therefore, I announce that Deputy Doublé has been appointed Chair of the Health and Social Security Scrutiny Panel.
So can I thank members for their support and invite expressions of interest to join the panel. Thank you.
Yes.
Those voting for Deputy Doublé, the Connétables of St Helier, St Clement, St Mary and St Saviour, and Deputies Labby, Doublé, Morel, Ayer, Gardner, Gorst, Ozef, Balash, War, Miles, Renouf, Rosebinet, Jeune, Miller, Howell, Ferry, Ward, Wilson, Stevenson and Andrews, and those voting for Deputy Poré, the Connétables of St Lawrence, St Brelard, Trinity, St Peter, St Martin, St John, Grouville and St Juan, and Deputies Southern, Tadier, Luce, Lehegara, Ward, Alves, Farnham, Mezek, Coles, Poré, Curtis, Kovac and Curtis. And Deputy Scott abstained.
So, sorry, can I just take this opportunity to congratulate Deputy Doublé and just wish you the very best on your new position. Thank you.
Thank you, Deputy. In accordance with the Employment of State of Jersey Employees Jersey Law 2005, the Assembly is due to appoint 2 members of the State's Employment Board. I invite the Chair of the SEB, the Chief Minister, to make his 2 nominations for members who are not ministers or assistant ministers. Chief Minister.
Thank you, sir, and can I thank members for their interest. I would like to nominate Connétable St Clements and Deputy Kovacs of St Saviour, sir. Thank you.
Thank you. Are the nominations seconded?
Yes, sir.
Are there any other nominations?
Please, sir, may I propose Deputy Balash? Thank you, sir.
Sir, can I second that proposition?
Thank you very much.
So could I propose Deputy Ayer, please?
Can I second that?
Thank you. Anyone else? So the nominations are the Connétable of St Clement, Deputy Kovac, Deputy Balash and Deputy Ayer. Now we now proceed with a secret ballot, and I invite the ushers to distribute ballot papers.
So just to clarify,
You're going to get, yes, Deputy Tellier?
just to clarify, it's up to 2 votes, not that we can vote for, up to 2 names.
Yes, you can put down 1 or 2 names. It's a secret ballot, so do not put your own name, unless, of course, you're a candidate, in which case you probably will want to.
2. We read both names on the same piece of paper.
Yes, on the same piece of paper. So to remind you, you can vote for 1 or 2 candidates, and the candidates are the Conotab of St Clement, Deputy Kovac, Deputy Balash, and Deputy Aye.
So will you accept a pencil?
Sorry?
Will you accept a ballot written by a pencil?
Yes, that's fine, yes. They're both empty, yes. All members been able to cast their votes, and more votes have been collected. The deputy greffier and the assistant greffier will retire to undertake the count. This is likely to take a little while, so we will proceed with the public business. Well, the business. So going back to the order paper, there's nothing under G or H. There have been some written questions to which answers have been provided. And we now come to oral questions on notice. I invite Deputy Andrews to put the first question to the Minister for Treasury and Resources.
Thank you,
Deputy
sir.
Andrews.
Will the Minister advise what consideration, if any, has been given to introducing a tax allowance or tax relief for lower income earners or students who self-fund their professional career development?
Minister.
Thank you, sir. Sir, in the short time that I've been in office, I have not had the opportunity to consider the merits or otherwise of introducing a new tax allowance or relief to support students. Nevertheless, my initial sense is that the tax system is probably not the right place to incentivise and subsidise training costs, primarily because many people, especially low earners such as full-time students, would not fully benefit from an allowance because the tax thresholds are now so high. Following Deputy Andrews' proposition last year, the Government is establishing a skills development fund, and I think that is likely to be a more appropriate way to assist and provide funding to those who are looking to retrain and upskill. I will soon be considering my tax policy priorities for 2024, and like my predecessors, I welcome input from all States members.
Thank you. Supplementary? Someone's got a device making a noise. Maybe it's not. Move on to question 2, which Deputy War will put to the Minister for Housing and Communities. Deputy War.
Can I pull this up on screen? Can I?
Sorry.
Will the Minister commit to widening access to social housing and reducing the age of eligibility for persons without children from 40 to 25 by implementing the timeline included in the roadmap for improving access to social housing in Jersey, published in July 2023?
Minister.
Yes.
Supplementary? I do, sir. Right, apologies for being unprepared here. So will the Minister bring forward the timetable for reducing the age of entry onto the housing gateway so that in March the new age limit will be 25, in line with his desire to overcome the housing crisis, and if not, why not?
Minister.
Well, sir, the timeline, as I understood it, was that it was proposed to bring the age down to 25 by October, not March. March is due to be down to 30. I would propose sticking with the original plan.
Joseph.
Sorry, sir, I don't think he answered my question.
Well, he did. He said it was in October and that was the original plan. So
My question was he intending on doing it earlier?
Well, he isn't. He's sticking to October.
No, okay, sorry.
Deputy Joseph.
Thank you, sir. So with that, yes, may I supplementary ask is how many additional people will be, in the Minister's view, therefore entitled to provision of social housing? Obviously, massively welcome, Mr.
So ultimately, we won't know that until it happens, because we don't know how many people currently don't fit within the eligibility criteria who will actually benefit from that if it is extended to them, or when it is extended to them, I should say. The last time that the criteria was widened as part of this phased approach, there weren't as many applications that the Gateway was expecting there to be at that point. So I think we should stick to the plan as it currently is, but it may be worth having some kind of think about advertising more widely that the criteria have been expanded, because I'm sure that there'll be lots of people out there who have been living their lives just expecting that they wouldn't ever be eligible for social housing, and if that does change, we need to make sure that they know about it so that we get the Gateway to being what it ought to be, which is an accurate reflection of what need there is for affordable housing in Jersey, and not just who happens to tick the box of the criteria.
Supplementary?
So, well, thanking the Minister for his reply, does he have any indication, a range, is it 100, 200? And the important supplementary question I want to ask is, what's he going to do to ensure that the supply of those houses is available?
And that last part is an extremely good point, because it would be foolish to widen the criteria when the supply hasn't been delivered, because that would overwhelm the Gateway and you'd end up actually achieving little apart from extending waiting lists and having people languishing there. So we're in a lucky position where, with the Cyril Lamarcon Court having been delivered, that has had a substantial impact in reducing the demand for one-bedroom homes, and that's not just people transferring from the private sector, it's also people downsizing within social housing, which means we free up 2- and 3-bedroom places to allow people into those. So Edinburgh House has, of course, also recently had people move into there, and relatively soon we'll be looking at the Limes as well. So that's quite a substantial amount of supply being put on in a relatively short period of time, which means that high urgent demand for one-bedroom flats can be managed better than we've been able to do previously, and I think that means it can be justified to expand the criteria without worrying too much about overwhelming the list, and I think we saw that last time it was expanded, that it just didn't happen.
Deputy Gardner.
Thank you, sir. And would the Minister advise and consider removing the need to provide a deposit under the First Step scheme about to make sure that the barrier that for the first-time buyers and young age might be overtaken? Sorry?
Minister.
So that's not this question. I think she's mixed up with a later question. The First Step scheme isn't to do with the roadmap for social housing.
So I would like to adjust this question. Apology. When you have when we expanded the scheme for 25 years old or younger or age to buy the property, would apology if I missed.
Well, it's the question on reducing the age for eligibility for persons without children. We'll come back to you if you think of a question, Deputy Garner. Deputy Chern.
Thank you, sir. As chair of JAF Youth, Jersey's Youth Homelessness Charity, we often see when we've had youngsters coming through and being supported by us when they are ready for independent housing, but under the age of 25, they are unable to find appropriate housing. So will the Minister explain if he will review the access for social housing for those under the age of 25, and if not, why not?
Minister.
So definitely, and I'm aware of instances of younger people who have been assisted by the very charity that the Deputy has referred to, and as they have got older, have faced arbitrary difficulties with transitioning to independence. So as part of our corporate parenting responsibilities, we accept that we continue to have a role in looking after children who've been through the care system, actually into what is legally considered their adulthood. So my parents didn't just throw me out when I turned 18, they let me live there for a little bit longer after that as well, and we should have the same approach to the children who are in our care.
Supplementary.
Thank you, sir. And understandably, of course, very important that we are, as corporate parents, take responsibility of those in our care. But unfortunately, JAF does see a number of youngsters who are not in the care system that also are vulnerable from homelessness and do, I believe, also need to be supported in finding that independent housing and giving them a safe and affordable place to live. So will the Minister therefore commit to developing a specific strategy to combat access to affordable housing for especially vulnerable young adults, not just those in care leavers under the age of 25?
Definitely so, and I'd be very keen to have that conversation directly with this particular charity and others that are involved in this area. I think that in the last few years we've seen the development of the Housing Advice Service, which I think is branching out into doing more than we anticipated that it would do to support people to find the right kind of housing for them. And as we continue to develop that, that could well be a place where we help people on an individual basis through those pathways. That's something I'd definitely like to consider, and I'm happy to have that conversation.
Thank you, Minister. Deputy Coles.
Thank you, sir. With the expanding of the eligibility, does the Minister agree that there may be a need to review the banding of priorities within the housing model?
Minister.
Well, so is the Deputy referring to the bands? There's band 1, 2 and 3, or is he referring to the criteria that distinguishes between them?
Sorry, sir. Yes, the criteria that distinguishes between the two, so ensure that the most vulnerable are taken before age.
So it wasn't that long ago that this particular banding was changed and was improved from what existed previously, and I think was simplified. I think it's fair to keep a watching eye on that and look at how demand is managed as the criteria is widened and that new supply comes on board. But this particular iteration of the banding system isn't that old yet at this point, so let's keep a watching eye on it, but I wouldn't yet suggest commissioning a kind of full review into it because it hasn't been in place for that long.
Deputy Sadia.
So my question was effectively asked by Deputy Jean, so I don't need to ask it.
Any further questions? Deputy War, final supplementary.
Thank you, sir. When we come to reducing the age of eligibility, when people go into the gateway bandway, there's an income level. It's an income criteria which is set at the point of entry. Now, obviously, with a younger generation going in, their income, their ability to increase their income will hopefully progress as the time goes on. Are there any considerations around looking at a rent review whereby instead of paying 80%, maybe those people end up paying 100%?
No, sir, charging 100% of rents is not social housing.
Thank you. Question 3, Deputy Jean will put to the Minister for Social Security. Deputy Jean.
Thank you, sir. Will the Minister advise what demonstrable outcomes have been identified from the free period product scheme, and will she confirm what future plans, if any, she has for expanding the scheme?
Minister.
Thank you, Sarah, and I thank the Deputy for her question. As you will know, I've personally been critical of and raised concerns about whether the scheme was meeting its intended outcomes, which are to address period poverty, meet individual needs, make it easy for people to access products, respect dignity, and support inclusion. At this point, I have not received sufficient evidence to demonstrate that these outcomes have been met or are being delivered. And I will be meeting with relevant officers next week to discuss how the scheme can be improved. As for scheme expansion, I'm keen to see improvements in relation to the location and process of obtaining products, and also a wider range of products being made available.
Supplementary.
Thank you, sir, and thank you for the Minister for her answer. Therefore, can the Minister advise how she will, for example, integrate sustainable period products into any future scheme that she is looking at, and how she will be able to work with the Jersey Sustainable Period Products campaign, for example, to provide those period products as part of the scheme, but also the education around such a scheme and introduction of sustainable period products, and if not, why not?
Minister.
I will be quite happy to look at ways in which we can incorporate sustainable period products into the scheme. There has been a review undertaken of the pilot scheme and the consultation in relation to that view. In relation to that review, did look at sustainable period products, and I'm quite happy to meet with interested stakeholders about how we can make those more available.
Deputy Doublé.
Thank you, sir. I want to follow up on the sustainable products, and would the Minister be specifically looking as under that umbrella of sustainable products, reusable and washable products, which of course are the most ideal products in terms of environment and cost savings? And if she would agree to include those in her scheme, how does she think they can be distributed to women that need them?
Minister.
Yes, I would agree personally to be including those particular products in the scheme. I know that different products are suitable to different people, and for me it's important to include a full range of products to ensure that we are fully inclusive. I am yet to have the briefing with relevant officers, and before making any further commitments, I do really need to understand the most sustainable methods and affordable methods for providing those products.
Supplementary.
Thank you, sir. Would the Minister perhaps look into making such products available on prescription, which is a pre-existing mechanism that could be used?
Yes, that's one of the mechanisms that I myself have been thinking about, but as yet I haven't had the opportunity to get the briefing from officers around whether indeed that would be viable and achievable. If it is viable and achievable, then absolutely I would be inclined to look at that.
Thank you, Minister. Deputy Scott.
Thank you, sir. Will the Minister be reviewing the performance measures that were used in rolling out the scheme and any gaps analysis that was entailed in it?
Minister.
Yes, I would be happy to do that. I was pleased that the original question referred to demonstrable outcomes. Outcomes is something that I am very keen to demonstrate and to measure, and with that in mind, I would be keen to take the review that the questioner referenced.
Supplementary.
No, thank you.
Final supplementary, Deputy Joan.
Yes, thank you, sir. Seeing that the Minister has expressed that she will be looking into seeing how the assessment of this scheme and looking how to maybe amend it as such, will she commit to working with myself and other Assembly members who are particularly interested in making sure the scheme is as successful as possible, and working also with organisations already who do this type of work in the area to develop a better offering, both in the sense of place, but also in what kind of products and the education around the use and benefits of sustainable products, for example.
Minister.
Yes, I am committed to working collaboratively with all members of this Assembly and with the relevant stakeholders as required.
Before we come to the next question, I'm going to announce the result of the elections for members of the State's Employment Board. The number of votes cast for each candidate was as follows. Conatab of St Clement, 31 votes. Deputy Ayer, 23. Deputy Balash, 18. Deputy Kovacs, 16. So the Conatab of St Clement and Deputy Ayer have been elected. Question 4, Deputy Gardner will put to the Minister for the Environment. Deputy Gardner.
Given the UK decision to ban disposable vapes to protect children and young people's health, will the Minister advise what consideration, if any, is being given to a similar ban in Jersey, and will he explain his current position regarding disposable vapes?
Minister.
Sir, the previous Ministers for Environment and Infrastructure made a commitment to bring forward legislation to ban the use of single-use vapes in 2024, with the intention of extending the Single-Use Plastics Restrictions Jersey Law 2021 to cover these items, and I will not be moving away from that commitment. Initial advice has been sought and received from the Law Officers Department. Officers from Public Health, Recycling, Trading Standards, Treasury and Policy are working together to ensure all aspects are being taken into consideration. These include the wider tobacco strategy, a future tax potentially on vapes, impact on local businesses, importation from internet sales and enforcement, to name a few. I look forward to getting a full briefing on this in due course so that I consider it together with the rest of my priorities for the next 2 years, but I commit to further discussing it with the new Ministers for Health and Infrastructure to agree the easiest, quickest and best way forward. Thank you, sir.
Thank you. Minister, supplementary?
Absolutely. Thank you to the Minister for the answer, and it's welcoming that the plans will progress. I would like to ask if Minister aware of being told that since the announcement on 11th of September, 5 months down the road, that was suggested that consultation will take place. We are 5 months after announcement. If the Minister aware if consultation has been prepared, and if not, what's the timeline he expects for the consultation to be launched?
Minister.
Sir, as I said, I haven't had a full briefing yet, and I can say to the Deputy that I'm not aware that a consultation has started yet. I do question the need for consultation on issues such as this, but I do believe also that we have to take into consideration the fact that there are businesses in Jersey that sell these products, and we need to speak to those people before we think of any ban. We have to consider the internet sales that come into the island through the post. We might ban the sale in local shops and find that they're all imported from the UK. So there are a number of considerations to put into the mix. And like I say to the Deputy, I can only report back once I've had a full briefing.
Sadia.
So the question is slightly strange in the sense it's predicated on health outcomes for young people, but it's being put to the Environment Minister because the vapes themselves are single-use plastics. Can I ask the Minister, what is the motivation for the banning of single-use vapes, and what is the difference between a single-use vape or a non-single-use vape for the outcomes of children in the island, and why is it his responsibility to ensure health outcomes as an Environment Minister?
So the Deputy asks the same questions that I asked when the question landed on my desk. But to be honest, this is an answer that could have been given equally by the Infrastructure Minister or the Health Minister, because I think we're all committed to this. We know that the sale of e-cigarettes in vapes is banned to children under the age of 18, and we want to continue that. But I think there is a case to be made for the quickest route to banning this product, stopping its sale, would be to use the single-use plastics law, and that may well be the reason why it's with me and the Minister for Infrastructure. I think if there's a commitment made to do something, it's then the requirement on me to find on us to find the easiest, quickest and best way to achieve that.
Supplementary.
So doesn't the Minister accept that this is very confused and muddled policy making, if single-use vapes are to be banned because they contain plastic, that is a completely different proposition for them being banned because they're harmful for the inhalation of children under 18. So could I ask the Minister to actually decide why he's banning single-use vapes, and also because they're plastic, and also look at, for example, our own behaviour in this assembly where we have disposable coffee cups where we used to have, I think, ceramic or ones, and that we have lots of single-use plastic in the States Assembly, which presumably also needs to be banned under the same law.
So vaping products should really only be used by smokers to reduce, quit or lower the risk of relapse back into smoking. We know that e-cigarettes and vapes are not products for children and they're banned for young people. It's important they are protected from their use. It's also important they're protected from tobacco and that vaping doesn't lead to children starting to smoke. I've outlined the issues around the single use. The Deputy may be well aware that disposable vapes are a complex product, if you want to talk about the physical attributes. A plastic, glass, cardboard case, a heating element, a microprocessor. They contain a very small lithium-ion battery, and then, of course, the liquids inside, which are usually nicotine, benzoic acid, piperonel, and benzyl alcohol. They're difficult to dispose of. They can cause trouble with they can be a health risk for those people who are trying to dispose of them, and of course they catch fire where they can have a problem with the dust carts and the incinerator. So there's a number of reasons, but as I explained earlier, if we make a decision to ban them, then surely the quickest route to do that is the one to use.
Colin Tarverson, Saviour.
Thank you, sir. I think my question has been partially asked by Deputy Taddeo, sir. The question was for regarding disposable vapes, but surely all vapes that are available to children, either legally or illegally, should be stamped on. And will the Minister, in consultation with ministerial colleagues, try and find the shortest route to stand this out? Because with vapes with flavours like toffee apple, popcorn and vanilla, it's no secret as to whom they are aimed at, sir. Does the Minister not agree?
Minister.
I do agree, sir. I can only reiterate, e-cigarettes and vapes are not products for children, and it's illegal to be sold.
Deputy Chairman.
Thank you, sir. Can the Minister explain how he has mentioned, of course, the consultation with businesses who sell the vapes, but how he will also consult with children and young people, because we are talking about them. And why I say that is because though we're saying under 18s they're banned, they do regularly have them. I know, for example, my son, not that I want to dob him in, but he regularly is on the school bus, and there is a group of them at the back, not him, using the vapes, using the disposable vapes, and so it is readily available and accessible for children and young people. So again, I would just like, the question may have been lost in all of that. Could the Minister explain how he will bring the voice of children and young people into this discussion, this ban? Consultation around this ban.
It's a very interesting question, sir, and one I really have to say I hadn't considered. It's not usual for the police to engage in consultation with people who regularly speed and exceed the speed limits. And in this case, it may be difficult to engage with young people who are, by vaping or smoking e-cigarettes, breaking the law. I guess their opinion is important, and I guess they would also say, I'd hazard to say that it would also say that they enjoy it. I would say to the Deputy, as a school child who started smoking at the age of 13 or 14 and hasn't managed to stop yet, just because you enjoy it doesn't mean it's a good thing to do. I certainly regret it.
Supplementary.
Thank you, sir. I wasn't trying to suggest that he only consults with those youngsters who use disposable vapes, but to also include young people into this discussion about the wider use of banning disposable vapes, not just for the health but also for the environmental impact as well. So it's just bringing in young people's voices into this because it's really important to hear their voices in all aspects of when legislation is being built.
Yes, sir, I can only agree. I think we will find, if we did ask a good cross-section of young people, that some would say it's a good thing to do, they enjoy it, while others might say that they find it a great nuisance, they don't like the smell, and they wish everybody would stop. So I guess the more questions we ask, the more different answers we would get. But yes, they need to be spoken to, and I'm sure they will be.
Deputy Joseph.
So the Minister is going to say that he's going to continue the policy of the previous Minister. Is he also going to pay close attention to the evidence that is now coming out from Australia, who banned single-use vapes as of the 1st of January? And would he agree to talking to his neighbour, the External Relations Minister, to get some real good research and evidence based upon the efficacy of the success or otherwise of the decision already taken by Australia on the 1st of January?
So one of the benefits of being a fast follower and not a leader is that you can take notice of other jurisdictions that have acted before you, and I'm sure officers, when they report to me in detail, will also report on other jurisdictions that have faced this ban and the challenges that go with it.
Supplementary.
And would he also agree that the issues of vapes, I have no taste or smell, but never smoked, but did start vaping after a tragic situation in my life. And I do understand the issues that people are concerned about. Would he confirm that he is talking about vapes that contain tobacco, not the vapes that are not tobacco?
So I think we're talking about all vapes, whether they can contain tobacco or not. Disposable vapes have challenges for the environment. They're thrown away. But I say to the Deputy that rechargeable vapes also are challenging for the communities, in as much as once you start recharging them, it's possible to recharge them with all sorts of products, some of which are not legal to be vaped or smoked in any form either.
I'm grateful, sir.
Deputy Doublé.
Thank you, sir. Does the Minister agree that commencing his child rights impact assessment at the earliest stage of policy development will help him to consider children's needs and their rights?
Minister.
As with most legislation, sir, the more you consult before you move forward, the better, and the more time you save generally. So I guess the answer to that is yes.
Supplementary. Deputy Garner, final supplementary.
Thank you, sir. Last year, when I met Holler School Council, they asked them about their concerns and what we politicians need to address. They have raised disposable vapes and mentioned environment, health, impact. When I put this question, I really thought which minister this question needs to be addressed, as it's going across health, environment, and infrastructure. Would the minister indicate who he thinks needs to be the lead minister for this piece of work?
Minister.
Sir, it's my understanding that the minister that would act under the single-use plastics law would be the Minister for Infrastructure. And in that case, I guess he would be the lead minister. But it's interesting to hear the deputy's recounting of her interview speaking to children. And if this is the last question, I might just end with this quote, which is from Dr. Janelle DeGrushy, a good Jersey name, but the Deputy Chief Medical Officer for England, who says, "The message is clear, sir. If the choice is between smoking and vaping, choose vaping. If the choice is between vaping and fresh air, choose fresh air." Thank you, sir.
Thank you, Minister. Question 5, Deputy Doublé will put to the Minister for Social Security. Deputy Doublé.
Thank you, sir. Given the Assembly's adoption of my proposition P54/2019 as amended, will the Minister detail her plans to complete the review into family-friendly elements of the Employment Jersey Law 2003, and how she intends to ensure the inclusion of a wide range of contributors?
Minister.
Thank you, sir. From my initial briefings, I understand that the current work plan is set to complete the review in Q1 of this year, and that the consultation period for the review concluded on the 22nd of December last year. I also understand that the Deputy had worked quite hard with the previous Minister to ensure that the consultation included more people from an early years background. I will be meeting with officers next week, and during that I will be seeking assurances that the consultation was inclusive and has received a wide range of contributors in order to inform this important work.
Supplementary.
I thank the Minister for her answer, and I believe, and I hope the Minister agrees with me, that the consultation should be extended, as it didn't go on for very long at all. Would the Minister commit to extending that consultation if necessary to ensure a wide range of contributors?
Minister.
If it transpires when I have briefings that the consultation did not get a wide range of contributors, then yes, I would be looking at potentially extending or looking at other ways to consult with such a wide range of contributors. Obviously, I would need to say that if that was extended, then the completion of the review may then be delayed, and I would also need to look at what impact that would have on other work. But I am committed to inclusion, so I would be seeking the assurances that this consultation was as inclusive as possible and representatives from all sides are represented within that.
Thank you, Minister. Deputy Taddeo.
Thank you, sir. It may seem like a strange question that I'm asking the new Social Security Minister, but does she also accept that there are many families in Jersey which don't have children? And just because a family unit doesn't have a children doesn't mean that they don't have right to also have some consideration in flexible working models. So would she consider perhaps looking to extend the traditional provisions to include flexible working more generally and working models that reflect proper work-life balances for all workers in Jersey?
Minister.
Thank you, sir, and I thank the Deputy for his question. I think it is a very interesting area, and I would be prepared to look at considerations of what could be done within the employment law around that area.
Supplementary. Deputy Chair.
Thank you. Does the Minister at this stage, having initial briefings, no kind of data has been collected and know how many parents are actually taking their full year of leave?
Minister.
I'm sure the Deputy will appreciate. I'm looking through my briefing notes trying to see. I can't see it in the notes that I have, but again, I think that is important data and information to have so that we can look at the success or otherwise of the legislation changes that were made and the supplementary programmes such as the parental benefit that support employers and employees to make the best use of that legislation. So I will commit to getting back to the Deputy with that data if I'm able to provide it. And if I don't have the data at the moment, I will ask officers if we can seek it.
Supplementary.
Yes, and I thank the Minister for committing that she will share the data with me, but also with the Assembly when she's able to get it. And I think drilling down further into that data, I think it would be important to understand how many fathers are taking their full leave, and if not, why not that they're taking taking that leave, and understand the barriers to that. So I'd like to ask the Minister if that is possible to look specifically further into the data and look at why fathers, if they take the full leave, and if not, why not?
Yes, I would also be more than happy to look at that. It was an important part of the update of the employment law that rights were extended not just to birth mothers but second parents as well. And I think it is important to look at that data.
Thank you, Minister. Deputy Gardner.
Thank you, sir. Would the Minister share her views how long she thinks is the best for the child to be cared at home by parents?
Minister.
My own personal view is that it's as long as possible that the parents wish to spend at home with that child. I know that people's personal circumstances very often mean that they do have to return to employment before they may feel ready. I was very fortunate to have a very long maternity leave with my daughter, and having that time was very important to me. I appreciate that I was in a privileged position to be able to do that. And I would seek to work to enable as many parents as possible to spend as much time as they can with their children. At the end of the day, it is a decision for each parent in consideration of their own circumstances and what might be best for them as well.
Would the Minister agree that the considerations are most of the time funds related, and it's not really choice, it's the choice between bringing food home and wages and care for the child, and what she is going to do about it?
Yes, I would agree with the Deputy's statement that very often decisions are made on the basis of cost. What I can, obviously what I can do about it is fairly limited, but I am happy to talk around that, around the Council of Ministers table, as well as look at further improvements to the employment legislation that meet the needs of employers as well as employees to try and improve the options for people with young children.
Final supplementary, Deputy Doublé.
Thank you, Sir. And following from that question, if it does emerge from the consultation that families aren't able to access this leave with their children because they can't afford to take that time from work, where would the Minister propose the funding should come from to support more paid parental leave?
Minister.
I'm not yet in a position where I've been able to see more detailed budgets for my own departments or discuss budgets across the table at the Council of Ministers, so I'm unable to answer that question at this point in time.
Thank you, Minister. Question 6, Deputy Wilson will put to the Minister for Health and Social Services. Deputy Wilson.
Thank you, Sir. Will the Minister advise what consideration he is giving, if any, to an evidence-based approach to developing healthcare in the island? And can he outline the areas where he would consider applying this approach?
Minister.
Thank you, sir. No doubt there's some challenging supplementaries that sit behind that question because it seems a little too obvious in the first instance. I think most right-minded thinking people would seek to use evidence-based approaches to most things, particularly when it comes to healthcare. So yes, going forward, that would be my preferred approach, and I have to say that would probably be my preferred approach in pretty much every area, sir.
Thank you. Supplementary?
So thank you. Could the Minister explain what his views are on the quality, reliability and validity of the evidence provided by the Royal College of Physicians in relation to the rheumatology review?
Minister.
Sir, I have to confess, I'm only 4 days into office. I haven't had a chance to read the complete review, but I have had a briefing on it. And I think the outstanding thing that stuck out for me was not just what's happened in the rheumatology department, but the question that struck me was, how did we get to this? And that relates to a number of concerns I have over governance procedures, sir.
Other questions? Deputy Joseph.
Sir, I hope the Minister won't mind me reflecting that there have been a number of discussions held by the previous Council on the actions, the serious issues at the hospital. And I hear him when he says that the report, which I have read, does point towards a bigger culture. And does he signal, therefore, that the importance of having a system whereby what was known and talked about for a long time but never reported in terms of rheumatology, I'm told, and that the board and the governance structures that were being put in and now seem to be resulting in proper analysis by experts is really important to get on with and stick with in order to give patients confidence for what is life-changing situations regarding things. In other words, is he going to stick with the governance model, in fact put it on steroids so that it actually even faster to fix the problems he's identified?
Minister.
So I have to say that I'm in broad agreement with what's just been said. I don't know if you can put governance procedures on steroids, but if we can, I think that's what we'd be looking to do. So.
Supplementary. Deputy Scott.
So, while the Minister is putting the governance procedures on steroids or not, will he be considering the Controller and Auditor General's recommendations in this area, given that they remain unimplemented even now?
Minister.
I think that has to be a yes as well, sir.
Deputy Chair.
Thank you, sir. Can the Minister outline his initial thoughts as to how these areas will be well governed?
The comment, these areas, if the Deputy could be a little bit more specific, that would be helpful.
Yes, Deputy Chair, do you want to particularise your question?
Well, the areas that he considers applying the approach of evidence-based approach. He said, because in the question it says, and outline the areas where he would consider applying this approach. And he said all areas he will be considering to doing evidence-based approach, and this was related to governance. And so my question is to ask the Minister how he will initially outline how he will how these areas or this approach will be well governed. So asking him more to answer that question around it when he's talking about how it's well governed or the governance around it. What does that mean? Explain it further.
In the broadest of senses, I think that means ensuring that we have a full and comprehensive set of governance procedures from one end of the organisation to the other, sir. It's difficult to be completely specific about that, other than to say that for there to be proper governance, it has to be throughout the whole of the organisation. There can't be any sort of grey areas, sir.
Supplementary.
Yes, sir, and I think this specifically focusing in on the rheumatology report, how can the Minister outline the actions he will take to prevent further issues around clinical safety, for example, in this area?
These are very early days for me, as I say, sir, but it's not beyond the bounds of possibility that we might consider commissioning a review of the governance procedures, an immediate review of governance procedures in the same way as we've reviewed the activities of the rheumatology department. I think what it's revealed is quite a staggering lack of proper governance, and that's something I need to discuss. As I say, it's too early days for me to know the full implications of that and the cost of it, but I think it's something that's going to be coming up for some consideration. So.
Thank you. Constable St Mary.
Thank you, sir. During a public hearing conducted by the Hospital Review Panel during the last Assembly, reference was made to as much as 25% of Jersey residents having the benefit of private health insurance. Does the Minister agree with that assessment? And if so, and even if not, is he planning to take further steps with a view to managing private health expectations within the public service and with a view to avoiding unnecessary drainage on the public purse?
A long way from the questions, Constable St Mary.
It's
too far from the question. I don't allow that question. Deputy Joseph.
I'll try. With the benefit of hindsight, which is always a good thing, Captain Hindsight is always right, normally, would the Minister agree that without the governance board being in place, it is more likely than not that this long-standing concern in rheumatology would not have been uncovered, investigated, and the report that he's now got on his desk done? And secondly, if the link is between the governance board and, as he's rightly said, looking into other areas, will he consider the cost implications of the cost of the health service, of lots of costs of people claiming of malpractice, let alone the misery that people have been put through by bad prescribing, and put that in the overall picture of cost? Because on the one side, we had quite criticisms of the cost of the governance, but it does seem, and he said it himself, that it's worked. and we need more of it.
Minister.
If you don't, I think I'm correct in saying that the deputy is confusing a number of issues, and principally the issue of the rheumatology investigation, which I'm pretty certain was launched quite a long time before the establishment of the board. So it's my understanding the two things aren't necessarily connected. So.
Yes, but this is a question about evidence-based approach to developing healthcare. Are there any supplementary questions arising from that question? Deputy Curtis, Alex Curtis.
Thank you, sir. And the Minister has said that all areas will be evidence-based. So will he provide a timetable to publishing any unpublished evidence used in the new healthcare facilities to States members? What would that timetable be?
Minister.
So I don't think I can do an ad hoc timetable for anything at this point in time, sir. I just think that's perhaps not reasonable, sir.
Thank you. Supplementary?
Yes, in that case, is the Minister happy to commit to publishing as much of any unpublished information on the new healthcare facilities to enable members to make evidence-based decisions as well as himself?
Minister.
So I have to say, in all honesty, I'm not aware that we've actually withheld any evidence of any merit whatsoever. So I'm happy to talk to the team about anything that they've kept to themselves. But to the best of my knowledge, we've not withheld anything that's of any relevance to the scheme, sir.
Deputy Wilson, final supplementary.
Thank you, sir. The Minister just mentioned a review of governance there. Would he agree to producing those proposals and sharing those with the Assembly in a timely way?
Minister.
Yes, sir. If that's something that we can do and it's feasible to do, then I'd be more than happy to share that with members of the Assembly, sir.
Thank you, Minister. Question 7, Deputy Renouf will put to the Minister for Health and Social Services. Deputy Renouf.
Thank you, sir. Will the Minister confirm whether he supports the proposed legislative timetable that, if approved, would bring hospital services under the regulatory control of the Jersey Care Commission by the start of 2025, with the hospital subject to inspection by the JCC later in 2025? And if not, why not?
Minister.
So I could answer that with a simple yes, but I suspect the Deputy might want a little bit more than that. As the Deputy knows, the legislation for this area sits with the Environment Department, and obviously when the question came in, I called a very swift meeting with the Environment Minister, and we had a short briefing on the Care Commission. As I say, I'm due to have a much more comprehensive briefing later on, but from the information I gleaned from the briefing that I've had, the answer is a firm yes, sir.
Supplementary?
Yes, sir. The question was motivated by an answer in the hustings where the Minister indicated he was not sure whether he supported that. Will he therefore, and the reason why it falls under both is because we have funded under the government plan a joint Health Ministry and Environment Ministry funding bid, which was passed by the Assembly in 2022 to fund preparatory work for that inspection. Will he therefore commit to bringing forward draft legislation by the third quarter of this year, sticking to the timetable currently in the government plan?
Minister.
Yes, I see no reason why that shouldn't be the case. As I say, in terms of the timing, I have to assume that everything's in place for that to be achieved, but if it is, then the answer is yes. If I can just clarify a little bit about having some reservations about the Jersey Care Commission, it's quite right that I did voice some concern, but I've been assured that the actual inspections are due to take place by the Care Quality Commission, seconded from the UK, and that was my concern, and that's been allayed, so I'm happy with that.
Thank you, Minister.
Sir, I think that might be inadvertently misleading the Assembly. It is the Jersey Care Commission under the legislation that will undertake the inspections, I believe with assistance from the Care Quality Commission in the UK, but the legislation is, I believe, quite clear on that.
It would appear that I've been incorrectly briefed in that case, but I certainly will make certain to find out what the details are and get back to the Deputy so that we can both be absolutely clear on what the intentions are. So.
Thank you. Deputy Chair.
Yes, thank you, sir. And this discussion has just prompted me to ask the question. The Minister able to answer in full now, but why would the hospital be put under a different system than the Jersey Care Commission, which is a legislation specifically built for Jersey and for Jersey institutions? And as someone, again, I know I've said a couple of times, but as chair of JAF, we are trying to strive towards being registered under the Care Commission, and many organisations and charities have also had to register under the Jersey Care Commission at great expense. And it would seem very strange that the main hospital in Jersey would then therefore take a different route than the legislation that has been specifically developed for Jersey. So could the Minister explain why there is a different choice of a different system than the one developed in Jersey?
Minister?
So I think at this point in time we're at odds about our understanding of what the intentions are. Why would you use an independent inspection service to actually carry out the inspection? Because hospital inspections, as I understand, are exceptionally complicated. And in my view, I would have thought it was sensible for them to be carried out by people who inspect hospitals all the time and know exactly what they're doing. If you have a team of people here that you've got to train up in all the complexity to inspect the hospital once every 3 years or whenever the inspections take place, it would be, I suggest, an extremely expensive business and not a terribly effective one, given that your inspectors won't necessarily be current for the inspection purposes. So I think there's some clarification that's required, and I'm certainly happy to get that clarification and feed that back to all interested parties, sir.
Supplementary?
Yes, thank you, sir. I think exactly. I think there needs to be a clarification, because it's one thing bringing in inspectors that have specific expertise, but it's another putting under which legislation. And of course, the quality control in the UK is under a different legislation than the Jersey Care Commission, and that is something.
Are you coming to a question, or are you making an observation?
No, so therefore, could we get a clarification as soon as possible from the Minister, please, on what is actually going to happen? Thank you.
I thought it made it very plain in my last answer that I'd get clarification as soon as I can, but I shall reconfirm that I'm prepared to get clarification as soon as possible. Thank you.
Final supplementary, Deputy Brennan.
Yes, sir. I think the reason why we can have confidence that the JCC can do this job is because the funding bid to which I referred earlier was precisely to build up capacity within the JCC to achieve the ability to do that. Given that the Massey-Taylor review and the recent rheumatology report both identified serious problems with oversight and highlighted a culture of consultants that did not want benchmarked clinical oversight, what reassurance can you give the Assembly and the public that independent governance, which might include these kind of inspections, will be a priority?
Minister.
I'm not quite sure how that relates to the initial question. Perhaps it is relevant, but I don't mind answering anyway. I would have hoped that I've made sufficient statements this afternoon that indicate that governance is a key area of concern, possibly the primary one, and that I should be doing all I can to make sure that we, as I say, going back to the initial question, put the process on steroids. I don't think I can offer much more than that at this stage, sir.
Thank you, Minister. Question 8, Deputy Southern will ask of the Chief Minister. Deputy Southern.
Thank you, sir. Following the adoption of P78/2022 and the response to written question 49 of 2023, will the Chief Minister agree to undertake a review of the options to convert the minimum wage to a living wage by December 2024, ensuring that such a review takes into account the impact of rental levels on relative low incomes, and if not, why not?
Chief Minister.
Thank you, sir. Members will be aware that the previous Minister for Social Security published a review, R181/2023, at the end of last year, sir. The review set out the reasons for continuing to work towards the existing State Assembly commitment of bringing the minimum wage up to a living wage at a level of 2/3 of the median wage. In light of this existing commitment, sir, I do not see the need for a further review at present, but I would like to say, sir, that I will be discussing this commitment with the Minister for Social Security and other ministers as a whole, sir, before further action can be agreed, sir. So I think it's very much conversations need to be had on that. Thank you.
Thank you. Supplementary?
If I may, sir, the issue, I think, around this question is that the time, one a time scale, and second, I don't believe anybody's done any work to evaluate the contribution that high rental levels have on poverty markers. And I believe that's two aspects that should be addressed in this consultation.
Is there a question at the end of that?
I believe that there is.
That's a belief of you. You normally add, do you agree?
Would the Minister agree?
There we are. Do you agree?
I agree, sir, that there are indeed many ways of calculating a living wage. If we look at what we call the Caritas living wage, which is £13.41, which is based on the London living wage plus 2%, then we have our calculations, sir, based on 2/3 of the median wage. So we could have a review that says we need to recalculate that and come to a different formula. I'm not sure, sir, that is right, and I want to discuss that with the Social Security Minister, who will need to take advice as well, I'm sure, and I think that's a matter that needs to come to Council of Ministers in short order, sir, given the timescale.
Thank you. Deputy Alex Curtis.
Thank you, sir. The Chief Minister in his hustings stated he believed certain businesses will need financial support during the transition to a living wage. Will the Chief Minister share in what form he expects this financial support to come? And if he does not see need for a further review, what consultation he'll do in finding out the answer to that?
Chief Minister.
So this is, I did caveat that the living wage, if we're going to introduce it in line with the state's commitment, we need to ensure that businesses are provided with financial support to help bridge the gap over a period of time, so we avoid job losses or damage to business, or even lose businesses as a result. I don't know what a financial support looks like to business. It could take on a number of different forms, from direct financial contribution to payroll. We've had experience with payroll schemes during COVID, or perhaps social security reductions on employees that fall into certain categories, but that's a piece of work that needs to be done.
Supplementary?
Yes, please, sir. If, as the Chief Minister isn't entirely sure how to do it, does he not think that a review would be a good option?
Chief Minister.
I think I'm running out of room on the shelf, sir, for reviews. I've only been in office a few days. I don't think we need a review, so I think we need to sit around the table with our officers. We're quite capable of producing something internally. Thank you.
Deputy Joseph.
Thank you, sir. In view of that very can-do attitude, would the Minister, who I know has another member of the Council of Ministers who likes the Economist article, will the Minister consider reading the Economist article, Britain's failed experiment in boosting low-wage sectors, which at the heart of it struck at the Brexiteers' plan to build a high-wage, high-skill economy? And the article explains that they have failed upon evidence. In other words, will his government actually use the economic advisor, bring some people quickly, and I'll send him the article, to understand how we can get to a living wage, high wages, with high productivity, with more than just words and promises, and making some sectors of our economy completely unproductive, unprofitable, and therefore requiring what I shuddered when I heard him say it, potentially bailing them out. And would you agree to have a meeting with me about my views, because I've got some?
Chief Minister.
If the Deputy sends me the article, I shall endeavour to read it at some stage in the weeks ahead. I don't make light of that. Also, yes, sir, I have a lot of time and respect for our economic team, the economic advisor and his team, who will be playing a key part in advising ministers as we move forward to try and achieve what this Assembly has been promising for years, sir. And in relation to having a meeting with Deputy Joseph, yes, of course I will, sir. If you'd like to make contact, we'll get something lined up. To look forward to it.
So the article takes 5 minutes to listen to when he's walking his dog in St. Wands, and I have to go with him and walk on it to explain to him what it means, because I understand the pressure that he's going to be under, his government's going to be under, to bring the living wage in, but the experiment that has happened in the UK, that is largely failed, and we spoke about productivity earlier, we must not, and I do not want his government to fail. I want them to succeed, but there's a way of doing it, and this explains it.
Thank you, sir. And I thank the Deputy for his kind remarks. And if you would like to meet me at 6:30 a.m. tomorrow morning at the bottom entrance of Valdemar Car Park, he can accompany me on the dog walk and he can tell me all about it.
I'll be there, sir.
Thank you. Deputy Renouf.
So following Deputy Curtis's question, if the Chief Minister can't identify a way to support businesses that struggle with a living wage, can he identify the business sectors that he think might need help?
Chief Minister.
So I didn't say I couldn't identify a formula. I can identify off the top of my head a number of formulas, sir, but that would not be good governance to do that, sir. We're going to do things properly this time. We're going to get proper advice. We're going to debate it around the Council of Ministers table, and then we're going to bring it to this Assembly, and that's how we are going to do it, sir. Industries that I think will need support are likely to include agriculture, tourism, hospitality, perhaps retail, and any other employers that have sort of larger payrolls, sir, where below minimum wage hourly rates are being paid. Thank you.
Supplementary?
Yes, sir. Does the Chief Minister not accept, slightly contrary perhaps to Deputy Ozeff's point, that if we do not have a living wage that persuades employers to meet what is a decent standard of living for citizens in this island, that we will effectively be subsidising through other means the payment of low wages and failing to drive up, to encourage employers to drive up productivity?
No, sir, I don't. And if I haven't been clear, I apologise. A minimum wage, sir, is to prevent exploitation. A living wage is to improve the standard of living. Sir. Now, what I'm saying is not a permanent financial package. It's a bridging support to help some employers to bridge the gap, to allow them time to restructure their workforce, restructure their pay rates throughout their organisations, to ensure they're not put under undue financial stress during this journey, which could lead to job losses, sir, or even worse, some businesses closing down.
Thank you, Chief Minister. Was your light on, Deputy Salio?
It was, sir. You're being very indulgent today, so the normal bailiff would have cut us off by now, but I don't need to ask my question.
All right.
Point of order, you're not the normal bailiff, you're the deputy bailiff, aren't you?
Well, let's put that to one side. Any final supplementary, Deputy Southern?
It's the eternal supplementary, which is always, when you finish with your conversations, with or without Deputy Ozeff, will you circulate the document that results from it to myself and members?
Of course, sir, but I would reiterate conversations need to be had with the Social Security Minister. This will need to come, advice will need to be taken, will need to come to Council of Ministers, sir. When we've done that process, we will share with all members, and I think the Social Security Minister can make sure that her colleague, Deputy Southern, will be the first to receive updates. Thank you.
Thank you, Chief Minister. Question 9, Deputy Southern will put to the Minister for Housing and Communities. Deputy Southern.
Thank you, sir. It is to have another question. Will the Minister, to the Minister of Housing and Communities, just to show that we give nobody any breaks whatsoever, will the Minister advise the long-term plans, if any, for Les Cinq Chênes estate and existing occupiers, and explain why rental tenants are expected to tolerate substandard damp conditions when houses earmarked for sale are being renovated and fully insulated before sale?
Minister.
Thank you, sir. And let's be clear that tenants up at Les Cinq Chênes should not be expected to tolerate substandard damp conditions, irrespective of what the short or long-term plans for that estate are. I'm due to meet with Andy Holmes on Thursday, sir, where I will raise the matter. I know of at least one constituency case that has made its way to me to discuss that. But sir, the long-term plans for Les Cinq Chênes as it currently stands is that Andium is hoping to redevelop the site except for 30 homes which have been earmarked for sale through the Andium Home Buy Scheme, which is their first-time buyers shared equity scheme. All of that is dependent on several things, ministerial approval being one of those, acquiring the sites nearby that have been earmarked in the Bridging Island plan for development, and a plan to ensure that those who currently live in rental homes there are assisted into even better homes elsewhere when they are available. And all of that is, of course, subject to many different conditions. But as I said at the start of my answer, sir, I don't think it is an excuse for neglecting any kind of maintenance of the homes whilst there are families still living in them. They should continue to meet all of the standards that we would expect there. And I will raise that with them at my next meeting with them.
Supplementary.
Yes, sir, if I may, is the Minister aware of whether these have been passed, as it were, as fit for human habitation through environmental health? Because certainly my impression is that many of these houses are not fit.
Minister.
So I don't know if environmental health themselves have officially declared that to be the case for those homes. If that is the case that they have done so, then that's clearly unacceptable, and Andium will certainly be hearing words from me to instruct them that that ought to be rectified at the soonest possible point. I would also say that when homes fall beneath minimum standards and the home becomes either wholly or partially uninhabitable, there is actually a clause in the residential tenancy law that would affect the amount of rent that tenants would be obliged to pay for that. So if that's not an incentive to get those fixed sooner rather than later, I don't know what is.
Tadia.
Thank you, sir. It will look like a planted question, but I just put my laptop open. I've got Article 9 of the Jersey of the law for residential tenancy, and my question is, when the Minister goes around to see the tenants of Les Sanctions, will he be reminding them of their rights under Article 9 of that law, which says that when a unit becomes uninhabitable through any other event than malicious damage or act by the tenant is not required to pay any rent or any other amount payable under the agreement in respect of any time that the residential unit is uninhabitable. And it also applies if it's partly uninhabitable, they can get a partial refund on their rent. Does he think that's a good incentive for all landlords in Jersey, not just Andium, to actually get their property in order if they're going to lose money for it?
Minister.
So indeed, that is the law, that is what it says, and that is a right that tenants currently have under the residential tenancy law, that they are not required to pay rent if a part or the whole of their home becomes uninhabitable. The only caveat that I'd put on that is that law itself doesn't clearly define what uninhabitable means there, so it would be very important before any tenant took action to that they made sure that they had a substantial basis underpinning it for any decision like that. I would say a report from Environmental Health confirming that a home is at least partly uninhabitable would hopefully constitute that. I would just advise them to be careful about making sure they interpret that law and don't end up putting themselves in further risk by misinterpreting it.
Supplementary?
Yeah, thank you, sir. Would the Minister look to go back perhaps with his officers and find that there is a legal opinion given on the floor of this Assembly by one of the law officers? I think it was an Attorney General, so I won't say who it was, can't quite remember. Actually explaining what the meaning of uninhabitable was and perhaps using that as a starting point for any potential legal action that they may wish to embark on.
Indeed, so if there is a clear legal opinion on that, that would be very helpful. But I would still recommend to any tenant that felt that they had to invoke their rights under that law to try to seek advice in one form or another before doing so, just to make sure that they are totally protected. But there is the Environmental Health Department who have the powers to instruct landlords to make repairs and undertake maintenance on properties when they fall beneath minimum standards, and there are sanctions that they can apply if that doesn't happen. And also we have the Housing Advice Service, which has blossomed in recent years to be a very good outlet for people getting advice that they need. And so I would certainly recommend to any tenants who think that they've got an issue to engage with that service, who can help them be informed of their rights too.
Deputy Joseph.
Thank you, sir. Having lived throughout the time I've lived in Jersey, in the vicinity of Five Oaks, I'm very well acquainted with the area. Would the deputy, now that we all know about the St Helier deputy blocked vote, there are 5 St Saviour deputies, 1 deputy chief minister who's a deputy of St Saviour, and we have our constable, and of course. And would he agree to meet with us, because the issues that are raised at Saint-Chen, I'm not well sure in his recent times whether he has been aware of the scale of difficulties that good people are having from not only damp conditions but other issues, and would he work with the deputies and meet us in early course after maybe the 6:30 run with the Chief Minister? Could do it tomorrow if he wants, but actually seriously, and meet with us, because all of the St Saviour's deputies have got views, and I'm sure that we can help him and contribute with our constable.
Minister.
So I'd be very keen to do that, not least because I have very fond memories of the Saint-Chen as well. I practically grew up there, even though I didn't live there, but all my friends were there. I spent lots of time there. I haven't spent a lot of time there very recently, though, but given that there is a suggestion of long-term plans for that area, I don't think it would be right to have any to pursue any plans for that without proper engagement with the St Saviour representatives, and I'm more than happy to be involved in any kind of discussion on that.
Deputy Southern, final supplementary.
Thank you, sir. Just to thank the Minister for taking this issue particularly seriously, and to encourage him to meet both with myself and of St Saviour's deputies representatives in order to bring some sort of conclusion to this, what is really lamentable standards being administered by Andium, who make great pride in building homes which are fit for people. But in this case, they have let themselves down, I think.
Is there a question there, Dr. Southern?
Will you do that, sir?
Yes, sir. As I mentioned, I'm meeting Andium on Thursday, where I intend to raise some of these issues as an early starting point, but at that I may also suggest to them that I have a site visit as soon as possible, and I'd want to include those who've expressed an interest in this area as well, but I'll give that undertaking and we'll have that first conversation when I next speak to Andium.
Thank you, Minister. Question 10, Deputy Gardner will put to the Minister for Children and Education. Deputy Gardner.
Thank you, sir. The SAIF's publication Further Education and Skills Actionable Agenda, published in December 22, will the Minister explain his plan for implementing the technical education action to raise the participation age to 18, with a corresponding entitlement and requirement for all young people to be in full-time education or employment with training?
Minister.
So the question will be answered by the Assistant Minister, who will be shortly the Minister for Education and Long Life Learning.
Yes.
Thank you,
Sir, can I ask, apology, Assistant Minister, it's skills agenda. If I understand correct, the skills agenda will be under the Minister for Children and Families and Skills.
Do you want to shed any light on that?
Or if I'm wrong, I'll be happy to be corrected.
No, we're happy that it falls under the Education Minister, sir.
Right. Are you content to accept an answer from Deputy Rob Ward? He's obviously prepared an answer. Yes.
Thank you, sir. And there is I thank the Deputy for the question. There is a context to this answer. In 2019, when I chaired the education panel, one of the first reviews was in post-16 education, and recommendation 14 at that time was to increase the school leaving age to 18 for formal education. In the question, the Further Education and Skills Actionable Agenda, it's recommendation 1, and that's from December 2022. So I am supportive of the principle of raising the age of participation to 18, but there obviously have been obstacles in the 4 years since the first recommendation of this happening. I think, sir, this is a sort of juxtaposition between the provision that's available for young people and the regulation or legislation that may be needed. So for context again, 80%, over 80% of our young people do continue to 18, or as we would call it, Key Stage 5. But that's a smaller number, but significant number, perhaps don't. And there is a lot of evidence to say that keeping people in education to 18 definitely improves outcomes and is better for all of us.
Thank you for the Deputy for his question. Thank you for the Assistant Minister for his answer. And it's reassuring that the Assistant Minister is willing to extend education to 18. As an Assistant Minister mentioned, he mentioned legislation and he mentioned provision, but the Assistant Minister didn't mention funding. Would Assistant Minister be preparing business case to submission to the next government plan to ensure that funding in place to provide education or training provision for young people up to 18?
Thanks, sir. And I thank the Deputy for the supplement. So in the 2024 government plan, there is, I believe, £3.85 million put aside to address those key targeted areas who don't carry on into education until 18. So yes, there will be a requirement for funding into the future. But so I think we have to look at the provision that we have now. And I think we have two choices in addressing this. We can try to change legislation, which may take some time because legislative drafting is one of those things that happens, or we can change by regulation. So the Education Law 1999, Part 2, Part 1, Section 2, Part 3, does say that this can be changed by regulation by the States Assembly. That might be a quicker pathway, but that will come, sir, with a requirement for funding. However, there is a lot in place already which may be available. It also comes with some perhaps knock-on effects to other laws and legislation, sir, so we have to be cognizant of that. I think the preparation work has been done, though, in many areas there, and I await policy options that can be taken forward. I will say so in the first week, so it's probably not necessarily on my agenda for this week. Thank you.
Deputy Doublé.
Thank you, sir. Does the Assistant Minister agree with me that as well as extending the education entitlement upwards to 18, we should also be looking to extend children's education entitlement downwards and offering some 2 to 3 provision universally to all 2 to 3-year-olds in the island?
Thank you, sir. This question is about 16 to 18. Which I certainly agree with. In terms of the provision downward, yes, that would be an ideal situation for us on this island. However, sir, we have to think about what we mean by formal education. Education in the form of play and socialisation, I believe, is just as important as any formalised, assessed education at that age, because that's so important for our young people. To get back into the 16-18 agenda, there are some real benefits, and they're recognised around in jurisdictions around the world, sir. And just give one piece of information on that, which I found interesting. From research, if you leave school at 16, you are very unlikely, but about 16% of those people who didn't reach the basic standards that we would require in terms of literacy, numeracy, for example, actually reach those levels. If you stay on to 18, sir, 60% of those people will get a second chance and do that. And so it's an investment in our future. It's an investment in our island, and it's certainly the best thing to do if we are genuinely looking at lifelong learning and having a skilled population. Thank you, sir.
Supplementary?
Yes, please. So I'm delighted the Assistant Minister agrees with my ethos around play-based care and education, and would he commit to pursuing the extension of this entitlement downwards as well, and to pursuing the funding to action this?
Well, it is a question about participation to age 18. It's not an early years question, but do you want to add anything, Deputy?
Yeah, it just won't be as prepared an answer. So in principle, yes, that's exactly it. But there's some detail to be had a look there. Can we provide that provision? How do we provide it? Where do we provide it? But I'm glad that the Deputy and I agree that play-based is the key. The last thing I would want to see, sir, is the sort of formalised education that started in the UK, where children are assessed at some ridiculously young age. And then from that level onwards, we're given a target or a flight path, which they had to, in some way, continue along for the rest of their educational existence. That doesn't work. It's not the best thing to do in education, and it's not what's best for our children, sir.
Deputy Chair.
Thank you, sir. And will the Assistant Minister outline what he believes is required to be done to meet all the actions from the publishable actionable agenda from December 2022 to ensure that all young people up to the age of 18 have equal opportunity to access education and training?
Deputy Ward.
Thank you, sir. Well, as I mentioned before, that over 80% already do that. But it's those hard to get numbers beyond that 80% that are the key things. And there are a whole myriad of things that need to be addressed there. First of all, we need to keep young people in school to the age of 16 and help them find that they are successful, sir. And we have a significant but small group who don't find mainstream school perhaps the best opportunity for them. That needs to be addressed. But then there are a number of things that happen through the Next Steps programme, for example, which provides this support prior to statutory leaving age to try and encourage young people to stay in the education system and access education. That can be through careers, through mentoring, things like the Princess Trust even. There are a whole myriad of things here. Ongoing support through a chosen pathway, for example, and that specialised pathway for young people who perhaps don't fit into our traditional education system, I think is the way in which we encourage people to stay in education, succeed in education and training and succeed both in the workplace and in our society. Because the option is, if that doesn't happen, it's much more expensive in the long run, much more damaging and much less successful for our economy and our productivity in the long time if these young people don't stay and don't succeed in education.
Supplementary.
Thank you, sir. And will the Minister just confirm, because it was a bit confusing at the beginning, that obviously some of this actionable agenda also has recommendations for skills, including adults, and will the Minister be responsible also for those actions as well? Thank you.
Yes, thank you, sir. So one of the things I wanted, I'm not particularly interested in titles, but lifelong learning I think is a very important key, which links into our sustainable economy, for example. So yes, I thank the Deputy for mentioning that. We do need to look at the future of access in education and in training, sir. Career changes, for example. I know people who have made a very brave decision to change their career as they get older, and it's not easy, sir. If we can enable that, training our own is the way forward to be successful on this island, to be more productive and to use our education to its fullest. But yes, that will need some thought, that will need some investment, but it also needs some smart use of the skills that we have. We have very talented people in our post-16 provision, both in all of our schools and at Highlands College in particular, and we need to use their skills to the best we possibly can and support people throughout their life and working life to succeed where they can, sir.
Thank you, Deputy. Deputy Joseph.
Thank you, sir. I wonder if the Assistant Minister could give an early indication about his willingness to look into T-levels as a way of really helping young people whose the right choice isn't university, sorry, not A-levels, but it is a really good, and now I notice that the UK is rolling out, there's an oven-ready plan with a curriculum for T-levels in all sorts of exciting areas, which have a benefit of, I think he knows about the answer. Will he put that one on steroids?
Thank you, sir. And I'm very pleased to be able to put down any notes and talk about T-levels. How long have I got, sir? T-levels are technical qualifications which are intended to bridge the gap between vocational and academic education. Personally, sir, I think there is a false dichotomy between between vocational and academic education. In any profession, medicine, for example, yes, there is a huge academic need, but there are huge vocational needs. I want somebody who knows their way around the human body if they're my doctor, but I also want to have a good bedside manner, for example. T-levels, though, sir, are being tested in the UK. One of the obstacles that we will face with T-levels, sir, is the need for specific and very long and detailed work placement examples. Now, I personally believe, and this is not policy on the hoof, but I have looked into this. I had quite extensive conversations before, actually, with people when I was doing the education panel, that we could perhaps offer some of these, if they fit in certain sectors of our economy. But we've got an opportunity, sir, to see whether they are successful first in the UK. We also have to be very cognizant of the fact that BTECs, the traditional vocational route, may not be continuing if T-levels take over in the UK. However, BTEC could still exist in an international form. So there are some big choices ahead, but the knowledge of T-levels, the knowledge of vocational education, and the knowledge of examples, for example, is something that I can bring to this role, and I hope that we can anticipate and be ahead of the game before we need to make those decisions, because that's the important thing that we have to do.
So is the Assistant Minister aware that the UK has already started in September 2022 T-levels in accounting, design, finance, maintenance, installation, management and administration, and now in 2023, last year, agriculture, land management, animal care, all sorts of these things. All things that are highly relevant to skills shortages in Jersey. And would he use his new position with his minister and the rest of the council ministers to actually get some pilot T-level qualifications? I'm delighted to hear that his enthusiasm is like the previous ministers. It's almost, I'm hearing the same thing, because the last minister was just as excited of T-levels when I mentioned them. But we've got to start rolling them out, because they are the solution, and will he commit to putting them on steroids and getting at least some courses up and running as fast as possible?
Thank you, sir, and I thank the Deputy. You can also add a very important T-level, which is in health and social care, which is very useful for the island. I don't think we should commit in that way yet. We need to take the advantage of the fact that we can see how they work. They have just started. We need to see whether they're successful, how successful they are, whether they fit our economy, whether they fit our provision, whether they fit our employers, whether they fit our young people. Because if they don't, then we could be going down a pathway where we lose what we have now that works without replacing it. I would be supportive of trials when we come up with the information that that is possible. And I think, sir, that we have a number of areas of our economy where these trials could work properly, very well. We also, sir, just one final thing on this, we need to be sure that those levels give access to further education beyond there as well. They are accepted by universities, not just in the UK, but Europe-wide and worldwide. That is a mistake that could be made if we're not careful, and that would be a very bad mistake for our young people going into the future.
Thank you, Deputy. Deputy Wilson.
Thank you, sir. Could the Minister outline what engagement he'll have with economic partners to develop an alignment with the skills development and the economic requirements of the island?
Yes, thank you, sir. And that's a very good question from the Deputy. One of the things I hope is happening in this government is also an alignment with other ministers. There is a Minister for Sustainable Economic Development, and I think it's very important that we understand where the need is as much as anything on this island, where the need is both in terms of our economy, from employers, and as somebody who has dealt with health would know that, for example, nursing and training our own in nursing, training healthcare professionals, training health assistants example is one really good example of that. So engagement with those people who can provide the training, provide the opportunities and have the need I think is a very important part, sir, of solving the issue we have with some recruitment areas on this island. If we train our own, we do it well to a high standard using everything that's available, we have a much better chance of retaining those staff because they have buy-in on the island, and every penny spent on that, and this is my bid in advance, I look across the Chief Minister, well, every penny spent on that is a huge return on that investment for this island.
Supplementary.
Yes, thank you, sir. Does the Minister consider that this will be necessary to contribute to the wider development of the workforce plan for the island, and how does he intend to feed his work into the development of that plan?
Yeah, thank you, sir. And again, yes, absolutely. To stand here 5 days in to tell you how precisely I'm going to feed in that into the workforce plan would be slightly difficult for me. However, the key principle of making sure we know where the gaps are, what provision we have now, because so there is provision now. There's provision across our education system. They are very successful. And we have huge successes, sir, with our young people going forward. But what we need to do is fine-tune that, use that the best economy as it changes. And so what we must remember as well, if we got to a point where it's 100% correct and we've solved the problem, the world will constantly change, so we will need to constantly change our education system with it. What we don't want to do so is throw change at educators. The worst thing you can do for teachers and educators is to have sudden change and uncontrolled change, because they're fed up with it. So they've seen it with curriculum for too many years, they've seen it with assessment for too many years, and they've seen it with the way in which they're meant to teach for too many years. So yes, it needs to be a controlled, intelligent approach. It's integral to our workforce that we get education right for those people. Thank you, sir.
Thank you. Final supplementary, Deputy Gardner.
Thank you, and I'm delighted to hear answers from the Assistant Minister. Just to the clarity and my understanding and Assembly understanding going forward, Further Education and Skills Actionable Agenda has 37 actions, which are divided into 16-19 technical education, skills and education post-19, apprenticeship, higher technical and professional education, higher education, department structure, and employee engagement. The question to the Assistant Minister, if he will be responsible for delivering actions from actionable agenda, or this will be divided, and if it will be divided, how the officers would know with whom to work on it.
Well, thank you, sir. And that's exactly the question we've been addressing. Actually, yes, that's a good question. The delivery of courses in education establishment will be my remit, because that's what education is about. In terms of which parts of the deliverable agenda are people responsible for, I would say this, sir. I don't think myself or the Minister for Children and would want to pass anything on to anyone else and avoid accountability. It may well be that we take on too much accountability for some areas. The fine-tuning of that accountability is less important than the fine-tuning of delivery of the outcomes from this actionable agenda. And I'll say again, sir, I started off by answering a question that, to be quite frank, was spoken about 4 years ago. This report was produced over a year ago. We need to get on with start delivering some of these deliverables from these reports, rather than worrying about just who's accountable and what officer is doing it. So,
thank you, Deputy Ward. Question 11, Deputy Jearn will put to the Minister for Infrastructure. Deputy Jearn.
Thank you, sir. Will the Minister advise whether he intends to ask Island Energy to explain their announcement of price increases of 12%, resulting in average households paying £13.80 more per month, at the same time as announcing that they will provide £11.56 compensation for customers affected by the gas outage that left some islanders without hot water and cooking facilities for many weeks last year? And if not, why not?
Minister.
Thank you, sir, and thank the Deputy for her question. So the immediate answer to the question is yes. I do intend to raise both of these issues with the gas company. When the announcement about the intended price increases was made, the gas company said it was due to several factors. These were listed as inflationary pressures on operating costs, high interest rates impacting on capital investment, and continued volatility in the wholesale market. The Deputy will know that the gas law does not oblige the company to provide detailed financial information to government other than what is included in its annual accounts. Nevertheless, we can and will ask for more detail and evidence of these factors, as well as the basis for the compensation payments offered by the company. Sir, I recognise the absence of competition in the market and the absence of any direct price regulation, that it's important for government is assured that the energy market as a whole is acting in the best interest of islanders. This is particularly important given the ongoing cost of living challenges islanders face and their concerns about energy prices. In addressing this as part of my new portfolio, I intend to discuss the matter with the Minister for Environment and the Minister for Sustainable Economic Development, who holds responsibility for the competition law. As the Deputy knows from her work in the previous government, it's important to remain aligned in this matter, which covers a number of ministerial portfolios.
Supplementary.
Yes, thank you, sir. Would the Minister consider setting up a compensation scheme for gas customers affected by the outage in the same way they did during the COVID pandemic for compensation of lost wages?
Minister.
Sir, that's not something I've considered in the last week, but it's something I'm willing to consider. There's absolutely no requirement currently for compensation to be offered in Jersey, and it's something I can take away and consider. Thank you.
Thank you, Minister. Deputy Sellier.
So the Jersey Gas Law in Article 89 says that where it appears to the states to be necessary to do so in the public interest, the states may, by regulations, determine the tariffs to be made by the company in respect of gas which it supplies. At what point does the Minister think that it might be considered in the public interest to actually suggest, to set the maximum charges that the gas company can charge local people for their gas?
Minister.
Thank the Deputy for his question. So, as I said earlier, I need to find out far more detail than I have at present. What I've been able to glean is from the internet at the moment, and I'll be looking for detailed information of that company's accounts. Clearly, the company has got to be able to invest in its infrastructure to be able to offer services going forward, and clearly that's got to be paid for. So I need far more detail before I can make a judgment. Thank you.
Supplementary.
Does the Minister agree that the principle of telling a business, especially when they've got a monopoly, what they may charge, is not necessarily that radical, and that we already do it with taxi drivers? We tell taxi drivers what the maximum they can charge for their taxis, even though presumably they have to reinvest in their taxi businesses and renew their cars. So is it not also the case for critical infrastructure like Island Energy?
So I think when we look at energy, we don't just look at one type of energy, sir. And I believe that we've got a responsibility right across the energy markets. We've shown restraint in terms of increasing taxes on fuel, for example. And I believe that we need to do the same with all of the energy and not just restrict it to gas. Thank you.
Deputy Stevenson.
Thank you, sir. The Minister, in the answer to the first question, referred to working to find so that the market is working in the best interests of islanders. What does the Minister consider to be the best interests of islanders in this case?
Minister.
Thank you, sir. I think the best interests of islanders is having a robust gas supply to those customers who use that service currently. And I believe that the robust supply, consistent supply, has got to be the highest priority in this case.
Supplementary.
Thank you, sir. And in his discussions with the company going forward, how does he propose to try to move the matter forward if the company doesn't provide the kind of detailed information that he's referred to in his earlier answers as being required from his point of view?
So it's too early to say that. I've not met with the company, I've not met with the officers who are responsible for this area. But when I do meet with them, I'm very familiar with company accounts and how to run a business. So I'll be looking at how highly they're geared, for example, in terms of loans. There'll be a lot of information that I'll be looking at. Thank you.
Deputy Doublé.
Thank you, sir. I'm pleased to hear that the Minister would consider a compensation scheme. When he's doing so, would he take into account the fact that many households with multiple children and multiple household members would have been even more adversely affected by this, and tailor the offering accordingly?
So I hope the Deputy doesn't think that I'm going to introduce a compensation scheme. I've committed to have a look at that, sir, and that's very different to actually introducing a scheme. And I will look at that in good faith. So the Island Energy recently published a 2023 review, and part of that on page 9 was their mantra. Putting the customer at the heart of everything we do means that we hold ourselves to account to deliver results that meet or exceed our customer expectations. So I think the recent actions of that organisation fall far short of that ambition, and I'll be telling them that when I meet them. Thank you, sir.
Supplementary. Final supplementary.
Thank you, sir. Given the recent occurrence, do you think regulation of Island Energy is appropriate? And if not, what needs to be changed?
Minister.
Thank you, sir. I think the Deputy is probably far more able to answer that question than I, sir, having worked on the gas for the last 18 months. So it's something I need to find out more about before I commit. Thank you, sir.
Thank you, Minister. Question 12, Deputy Renouf will put to the Minister for Housing and Communities. Deputy Renouf.
So, thank you. Will the Minister explain what steps he will take, if any, to ensure that plans brought forward by Andium Homes for the redevelopment of the St Saviour's Hospital site will respect and protect the heritage value of the Grade 1 listed building?
Minister.
Thank you, sir. It's not impossible that the Deputy may know more about what's happened up until this point than I do myself now, as I haven't had a direct update from Andium on it. But what I can tell the Minister is that I am a Minister who cares very much about Jersey's architectural heritage. I respect the Grade 1 listed status of the building and the lawn in front of it, and I would not like to see anything done to jeopardise the heritage value of that site. And in conversations that I have with Andium Homes, I'll be making it clear that that's an expectation that I have.
Supplementary?
Yes, sir, I'm very pleased to hear that. I think the point I would make is that we've had recent excellent talks from the Association of Jersey Architects, which include presentations by Salman Alford, former president of RIBA, and Christopher Egret, both of who argued strongly for the retention and reuse of heritage buildings. And would he agree with me that when he talks to Andium Homes about the redevelopment of the site, that should be a priority, particularly avoiding what is referred to in recent supplementary planning guidance as facadism, i.e. just the preservation of a facade of the building rather than the building itself with its integrity and its setting.
So I completely agree with that, and to protect, enhance and get the best future use out of an old building like that, it doesn't necessarily mean protecting every single brick, but it does mean, I think, doing more than just a superficial element of it. We can see examples, not just in Jersey, but around the world, of efforts that have been made to preserve the architectural heritage of buildings and even have them inspire nearby buildings as well. That helps add to the character of an area. I think having such an old and fantastic building like the old St Saviour's Hospital there, that provides what I hope will be an opportunity to try to strike as best a balance as we possibly can in creating a new and vibrant community there, but in the context of something that is an important part of Jersey's history, that I'll be making it clear I want as much done as possible to protect and preserve.
Deputy Ward.
Thank you, sir. And I'm conscious I've probably got a bit of an advantage on the Minister on this particular question in connection with St Saviour's Hospital. One of the aspects of this hospital is the issue around viability. And I'm very conscious that Andium have drawn up a scheme and are questioning the viability and how they can make the maths stack up. I think that I understand that the island plan says it's an affordable housing site. Would the Minister consider part affordable housing, part private, as a way of bringing this scheme forward?
Minister.
So I think that there are clauses in the planning rules that allow for viability tests and for the percentages that are otherwise dictated to be altered if it can be proven that that's the only way of getting something to be achieved. I would not allow for a situation where large parts of that site were levelled to the ground to make things easier. If it requires us to look at things again and have a different approach and work with the new Minister for the Environment and new Minister for Infrastructure to get the right balance there, then that's something, of course, that I'm prepared to do. But I don't believe in taking what in one sense would be the easy route out, which is to just say, do whatever you like with the site. I think we have to be tougher than that.
Supplementary? Deputy Stevenson.
Thank you, sir. And I was very pleased to hear the Minister refer to creating a vibrant community here, because obviously his title does include communities as well, and we know that good housing isn't just about the four walls that a person lives in. With that in mind, what steps will he take to ensure that the redevelopment of this site includes quality amenity and community facilities, particularly those for play and sport and recreation, while of course respecting and protecting the heritage value of the listed building?
Minister.
So I think those are things that the supplementary planning guidance considered as well. You can add into transport links to that too, so people can get around adequately. We know that that's an area with a lot of pressure for school places too. So all of these things have to be considered. The supplementary planning guidance was put out for consultation. I don't think it's actually done yet. So I think we'd have to look at that when that process is complete to make sure that it strikes the right balance. But I want that to be an extremely pleasant place for people to live, and that means having a good place for children to play, good space for families to get together and enjoy themselves. And so that I want to see that included in whatever scheme we come up with. And just imagine what a beautiful setting it will be if we preserve that wonderful building there and have that add to the character of that new neighbourhood.
Supplementary?
Thank you, sir. Yes, it's my understanding that I think the supplementary planning guidance, certainly in relation to play, is still outstanding. Will the Minister, with all of that in mind, take it upon himself to chase up where that guidance could be? Because I think it would be hugely beneficial for those bringing forward such schemes to know.
Very good point. If that is outstanding, then that should be chased up. But I don't think that should stop us in the meantime for saying if you're going to have a housing development where inevitably lots of children are going to be living, we don't need to wait for that to know that it's the right thing to have decent facilities for those children to play and socialise with one another.
Thank you, sir. It's not just the fabric of the building of St Saviour's Hospital, which I think is important, but the actual history of it itself. It is one example where the Lieutenant Governor of the day rarely had to intervene with the state's decision to exercise the power of veto, because the states were extremely reluctant to spend money on a purpose-built asylum, and one has to wonder whether they were scared of the competition. But more importantly, does the Minister believe that there is actually a more fundamental way that we need to make sure we look after our public buildings and perhaps privately owned ones? One of which is to make sure that we fully account for the deterioration and depreciation of those buildings by putting adequate funding in place year on year and building up funds, and also making sure that the funds that were depleted to allow grants to be allocated for heritage buildings should be reinstated and restored.
Thank you, sir. I think I can answer that by saying most of the practical applications of what he's just suggested would fall outside of my remit. I think they'd fall to other ministers, but I agree with everything the Deputy just said.
Supplementary?
And I suppose the supplementary has to be that in the spirit of collaborative working, would he make those views known to ministers who do have that remit to all pull in the same direction to protect our important history and heritage?
Yes, of course, and I think that the St Saviour's Hospital site probably provides a good springboard for doing that.
Deputy Balash.
Sir, given that St Saviour's Hospital was originally part of the health estate, would the Minister consider working with the Minister for Health to reserve part of the accommodation for nurses and other health workers so as to encourage the recruitment of these much-needed workers?
Minister.
So not necessarily. It is quite a bit out of the way, and I know that there are plans for the health village just very nearby to where some of those health facilities currently are. So I wouldn't rule it out on that basis that some workers would benefit from having close proximity to their place of work if they have key worker accommodation there. But with the wider health property portfolio, to be honest, that might not actually be the best site, and there'll probably be other places that are closer that would be more convenient for them, especially if they're new to the island and haven't quite got to grips with how to get around yet.
Supplementary? Final supplementary to Deputy Renouf.
So thank you. It's encouraging to hear a Minister balancing the different priorities. Can I urge him to maintain his resolve if he comes under pressure to compromise on the heritage versus the housing supply, housing viability side of things, as these tensions are quite common in development issues, and I think the heritage value of our key Grade 1 listed buildings, which means that they are of international significance, should be very high up in our list of priorities.
Minister.
Thank you, and I thank the Deputy for his encouragement on that, and I hope that, as well as that encouragement, I hope that he will be able to provide his share of the political pressure as well in case anything comes back that doesn't strike that right balance. But certainly whilst I'm sat around the table, I'll be making my views absolutely clear that the heritage value of this site and maintaining and preserving it is of paramount importance.
Thank you, Minister. Question 13, Deputy War, will put to the Minister for Housing and Communities. Deputy War.
Thank you, sir. I'm conscious I'm hopefully going to get a yes answer to this. Will the Minister commit to launching the government's First Steps first-time buyers home ownership shared equity scheme by the end of March 2024?
Minister.
Yes.
I have to say I'm very pleased to hear that, so that's encouraging news. One of the asides or information in the background of that scheme, obviously it's targeted at medium to lower income families. And one of the issues which was raised to me was the issue around the 5% deposit, which is being asked. Would the Minister consider removing the need to provide a deposit under the First Step scheme, should this prove to be a barrier for uptake?
Minister.
So I think we have the benefit of the plan for this to be to release funding in tranches for it. If it becomes apparent that there isn't the uptake of it in the early stages of that, then it would be stupid not to review the parameters to make sure we encourage people to actually apply and benefit from it. So that's something to keep an eye on, but I would prefer to wait to see how those first tranches go and what the uptake is before deciding whether definitely to do that or not. But I think that's the point of doing it in tranches, so that if anything does need to change based on uptake and how many people apply, we can try to be flexible.
Dr. Stevenson.
Thank you, sir. Does the Minister have any plans to review the eligibility criteria for this scheme and by extension the other schemes, because they all follow the same criteria, specifically the criteria which state that the size of the property that the person wishes to purchase should reflect the needs of the household at the time of the application?
Minister.
So not in the short term, because the scheme isn't up and running yet. A selection of criteria for applying to it has been constructed already. I would prefer to see how that goes before changing it. The only potential exception to that is that before we launch, I think we're due to get a new house price index published, which we just want to keep an eye on to make sure that the income thresholds are exactly right. I'm not saying anything will necessarily change from there, but that's just one bit of information that will be published before we go live that we need to keep an eye on. But at this point, I don't want to tinker with it drastically. I want to see how it goes.
Supplementary?
Yes, sir, thank you. Does the Minister believe that this policy around the size of the household at the time of the application, and particularly given that it ties up all of the assisted purchase schemes under the same eligibility criteria, and as I understand it, after the Bridging Island Plan debate, ties up also now a percentage of parish schemes as well. Does he believe that it is an effective way of encouraging young islanders to grow their families and to see a future in the island, or could it be improved to take a longer-term strategic view?
Minister.
Potentially, but I think, as I've said, we have come up with criteria for it, and I want to see how that goes first. I'm sure that there probably are improvements that can be made, but we're about to launch a scheme providing this kind of support in this shape for the first time, and I'd like to see what kind of uptake there is on it in the first instance. If it is not what we're anticipating or people aren't coming forward to it, then that's the kind of thing I might seek to look at that point. But I don't want to tinker with it too much now and would prefer to see how it goes.
Deputy War, final supplementary.
Thank you, sir. And again, I'm conscious that this is early days, but I'm sort of going back to my day as the housing minister, where the then deputy challenged me about a funding mechanism for the first step scheme, which he suggested should be a stamp duty. I noticed that in the press reports he talked about if the scheme was successful, he would look to get further funding, but that funding would come from a new government plan. In his efforts to get things moving faster, would he consider alternative funding plans instead of waiting until the next government plan?
Minister.
Yes, I would, but that would require consultation with the rest of the Council of Ministers to identify that, but I will be banging the drum for that. I think the makeup of this scheme is good. It's a really good starting point. I want to see it benefit as many people as possible, and that, I believe, will require more funding for it. And if I can do that sooner rather than later, that's what I'll do, but I'd have to speak with other political colleagues to secure their approval for that as well.
Thank you, Minister. Question 14, Deputy Andrews will put to the Chief Minister. Deputy Andrews.
Thank you, sir. Will the Chief Minister advise whether he will now be abandoning calls for an analysis of the costs associated with the Overdale Hospital site versus the new multi-site healthcare facilities, despite expressing his concerns regarding the cost of the multi-site healthcare facilities since his re-election in 2022?
Chief Minister.
Thank you, sir. I currently have no plans to seek further clarification. Having spoken with Deputy Binet about the situation, given that he has been at the forefront of the project for the last 18 months, I'm fully aware of the implications and challenges that are ahead in preparing this work in detail, sir. And Deputy Binet has, I believe, assured this Assembly that he will proceed with full transparency on costings and detail. And I think that's going to be important, sir, to win over the Assembly. So on balance, with all of the information available, I have concluded, sir, that the best chance we have of proceeding with the new hospital, and therefore in the best interest of Islanders, is to continue with Deputy Binet leading the multi-site scheme. Thank you.
Supplementary?
Yes, please, sir. Can the Chief Minister confirm whether he is of the belief that the Health Minister would have supported his candidacy for Chief Minister had the Chief Minister maintained his stance in support of the Overdale Hospital site?
Chief Minister?
I believe he would, sir, but you'll have to ask him that because the vote of no confidence was brought on completely different issues, sir, far more, I would say, important issues in relation to the way the island was being governed, sir, not over previous plans for a hospital.
Question 15, Deputy Doublé will put to the Minister for Children and Education. Deputy Doublé.
Thank you, sir. Will the Minister please advise what plans he has for progressing the same-sex parental rights legislation, which will update the Children Jersey Law 2002, the Marriage and Civil Status Jersey Law 2001, and associated consequential amendments, and what priority he will be giving to this work?
Minister.
Thank you. Sir, P104/2023, the draft Children and Civil Status Amendments Jersey Law, was lodged by my predecessor and is currently being reviewed by the Children Education Home Affairs Scrutiny Panel. To allow enough time for the review to be completed, the debate has been listed for the sitting starting on the 19th of March. And I would hope that, certainly from my point of view, there is no reason to change that date. So depending on the outcome and the timeline of the panel's review, I fully intend to prioritise this work and proceed with the debate, as I've said, on that date. If at all possible, I want to avoid any further delays for the families who are keenly and patiently waiting for this important legislation to be debated.
Thank you, Minister. Supplementary?
Thank you, sir. Will the Minister ensure that there is sufficient officer resource to make sure that the consequential amendments are completed and before the Assembly, well before the end of this year, please?
Minister.
Yes, sir. As I've said, I do not wish there to be any delays. I fully support this legislation, and I will continue to prioritise the creation of the legislation to the same extent as my predecessor and ensure that it has the appropriate level of support. Thank you, sir.
That brings the period of questions to an end. And the next matter on the agenda is questions to ministers without notice. And the first period of questions are questions for the Minister for Health and Social Services. And the first question is from Any questions for this Minister? Deputy Sadia.
We wouldn't want to disappoint him, sir, on his first day in the job. So I think it was touched on by the Constable of St Mary, and I had cause at lunchtime to speak to a lady about private healthcare. I won't go into too much detail, but she said that if it wasn't for the fact that she didn't have private healthcare, she probably wouldn't be alive because an illness she had was only picked up because of that. Does the Minister believe that there is a divide in accessing suitable healthcare depending on whether you can afford private healthcare or not in the island, and what does he think is the solution if that's the case?
Minister.
First, I'd like to thank the Deputy for being so considerate. Really wasn't looking forward to the prospect of not having any questions, so he's at least helped me on that front. Private healthcare. I accept the Deputy's contention that there is a difference in terms of the availability of healthcare depending on whether you've got private health insurance or not. And I think the answer to that is simply to improve the quality of the healthcare provision that we've got in terms of actually making it better and reducing waiting lists so that we get as much parity as we possibly can. So.
Supplementary.
And it's related, sir. What does the Minister think is the correct and acceptable split for the amount of work that consultants do privately and what they do for the wider public?
Minister.
Forgive me, sir, but I think that's too complicated a question for me to answer at this stage, and I don't think I can actually add much to that, sir.
Thank you. Deputy Stevenson.
Thank you, sir. The Minister's declaration of interest states that he's a trustee of the charity Focus on Mental Illness. Given that he now controls the budget for mental health, does he consider this to be a conflict of interest, and how will he be dealing with that conflict?
Minister.
That's certainly correct, sir. I do deem that to be a conflict of interest. I have every intention of stepping down very soon, just going through the process of trying to find a suitable alternative chair, sir.
Thank you. Supplementary.
Yes, sir. What will his ongoing relationship with the charity be, and will he continue to attend meetings or be involved in the decision-making process in any way?
Minister.
That's sort of yet to be defined. I obviously had a very close interest in mental health care and mental health problems over a long period of time, so I have to maintain a certain association because quite a lot of the funding comes from Deputy Pinner and myself. So in that respect, we have to remain connected to the charity. But in terms of the operations of it, I think it would be improper for either of us to have any direct impact on that. So.
Thank you, Minister. Conatable Trinity.
Thank you, sir. Although members have received an interesting update from the Infrastructure Minister this morning about the relocation of Samaray Ward to St Ewold's, I would still like to ask a question of the Minister. Is the Minister able to outline in broad terms his anticipated programme for the first phase of the hospital project, i.e. when does he expect to submit the first planning application, and when we can expect to see a contractor appointed and a spade in the ground? Thank you, sir.
Minister.
So I'll do my best to run through it in sequence. There's been a little bit of a gap in the last month in terms of catching up on the detailed plans. They're ready to be released just about. I think we need to probably take another week or 10 days to sanction those for release, and they're just sort of outline plans to give people a chance to have a vision of what it's likely to look like, the acute section. Still hoping to produce a business case before the summer recess, and hopefully on or about that time produce a set of plans ready to submit. The hope is that we'll be about another 6 months or thereabouts in getting the permissions through, if all goes well, and contracts running into next year, and hopefully construction underway sometime during the course of 2025. I don't think I can be a great deal more specific than that at this stage, so.
Supplementary.
No, thank you, sir.
Deputy Southern.
Thank you, sir. Last week, in question time, the Minister had the positive response to whether he was going to continue to progress the health access scheme, ensuring affordable access to primary health care in the island, but balked and said no when asked if he would expand the scheme. He said, "I do not have sufficient information." Has he got any more information this week?
Minister.
Embarrassingly, sir, the answer to that is no. And I'm afraid I don't. I've had a very limited amount of time, and I'm afraid that hasn't managed to be one of my priorities at this stage. But it is definitely something that's on my agenda, sir.
Would it assist the Minister if I were to inform him that I believe a review of the impact of the health scheme has been done and awaits his perusal, I believe? Is that the case?
I have to confess I wasn't aware of that, but if it is available, I'm sure it'll be put in front of me very soon. And if the Deputy is able to fast track that for me or to point me in the right direction, I'd be quite happy with that, sir.
Thank you. Conor Thompson-Brillard.
Thank you, sir. My question's already been asked.
Deputy Doublé.
Thank you, sir. Is the Minister aware of the Jersey Health Profile, which was published earlier this year? And if not, would he commit to examining that report and give particular attention to the health inequalities outlined within that report?
Minister.
Yes, I think it would be rather daft of me not to accept that. I'm happy to do that. As to when I can prioritise that, I can't commit, but I certainly will have a look at that as soon as time allows, sir.
Supplementary.
Thank you, sir. Would the Minister seek to receive a briefing from his officers on the health inequalities outlined in the report so that he can work towards some solutions for families that are living in relative low income and have corresponding poor health outcomes because of their low income?
Minister.
So I don't have any problem with that at all, sir.
Thank you. Deputy Jern.
Thank you, sir. Will the Minister confirm his commitment to the dementia strategy and confirm that he's minded to still have a timely public launch to ensure no further delay, and if not, why not?
Minister.
Once again, that seems very remarkably sensible, so the answer to that is yes, sir.
Supplementary.
Thank the Minister for his brief answer. And will the Minister confirm that he's committed to implementing the priorities outlined in the strategy and the resources required to implement key actions, and if not, why not?
I'm sure the Deputy will appreciate that I haven't had a chance to look at that in detail, sir, but I'm sure that if it makes sense, and I'm sure it does, then I'd be very happy to make sure that we move with all speed, sir.
Thank you, Minister. Deputy Brenoff.
Yes, sir. Returning to the question raised by Deputy Stevenson, has the Minister taken advice from the Charity Commissioner or from officers about the potential conflict here? Because simply by removing himself from the board, it seems to me that if he is still a major donor of to a charity and remains in control of the budgets that might be attributed in this area, then this might represent a conflict. And so would he give further consideration to whether he needs to address this, if you like, from the other side of the equation, and particularly his role as Health Minister in giving money to that charity?
Minister.
I'm not quite sure what the Deputy means by being in control of the budgets. Donating to a charity is a private matter, and I don't think that conflicts with anything, sir. And by donating to the charity, it doesn't mean that I'm in charge of how the money gets spent if there's a different board of trustees. So I really don't think that's an issue, sir. But I'm quite familiar with the conflicts of interest involved, and I think the charity's in its fourth year, and I've had various dealings with the Commissioner over the course of time on conflicts of interest, and I intend to be in touch with him on this to make sure that my conduct is appropriate, sir.
Supplementary.
So the point I was trying to make is that he is in charge of health policy. He will be in charge of monies that might be allocated or in policies that might apply to that charity, and that he might remain as a significant figure in that charity. And the relevant section, I believe, in the Charity Commission law says that anything that in terms of the any interests they might hold, it's not just about a position on a board.
You got a question there that arose from that? Was there a question? Oh, right, yes.
It may help the Deputy to know that we haven't had a single penny from the state to date, and I don't think that's, I genuinely don't think there's an issue here at this point in time, sir.
Deputy Wilson.
Thank you, sir. Could I ask the Minister whether there's been any progress on the appointment of the Chair of the Health Board?
Minister.
Yes, to the best of my knowledge, there are now 2 candidates, and I'm due to meet them, I think, during the course of next week, sir.
Supplementary.
Thank you, sir. Can I ask when we expect to see those candidates, or which preferred candidate is in post, takes a post?
As soon as possible, sir. I would hope within the space of the next couple of weeks.
Thank you. Deputy Doublé.
Thank you, sir. Whilst considerable improvement has been made to waiting times for children to have assessments for ADHD and autism, could the Minister elaborate whether he is minded to look into this area for adults and look at the waiting times for those assessments?
Minister.
And there seems to be an awful lot of very specific questions, and if I could advise members that if they've got specifics, it's difficult for me to make a whole series of commitments at this point in time, and I'd be very happy to receive any particular concerns that people have by email so that they can be put into the pot, as it were, and prioritised appropriately, sir.
Supplementary.
Thank you, sir. In the first instance, would the Minister seek to receive a briefing from his officers on this issue?
Certainly, sir.
Thank you, Minister. Are there any additional questions for this Minister? Conor and Saviour.
So I was about to propose the adjournment, sir.
Well, should we be clear that there are no further questions for this Minister, so we know that we're moving on to the next one tomorrow? Is that right? Yes, so that concludes the questions for this Minister, and the adjournment has
So
been...
before you adjourn, can I just ask for direction as to proceedings tomorrow after questions, whether if panels wish to constitute their membership tomorrow, whether that's in order? So I'm not saying we necessarily would be in a position to do that, but if it were the case.
We were expecting it to occur at the next meeting, but you're right in saying it could occur at this meeting, but we were expecting it at the next meeting.
It may be helpful to, if there are panels which could be constituted, even if they're not in their entirety straight away, because a 3-week period is, 3 weeks wasted potentially. That scrutiny could be doing work constructively on. I would suggest that if there are members who would like to join panels, that they either make themselves known, or for chairs to extend that invitation, and that could be done this evening via the usual channels.
Well, certainly, Deputy, we can accommodate that, and that will occur if the panels are ready to be constituted, wholly or in part. Yes, the adjournment was proposed. Are members content to adjourn now? The Assembly is adjourned until 9:30 tomorrow morning.